agency will figure it out so that we can continue to use therapies of questionable value for which there's a growing list of risks and harms. And I just don't think that's in the best interest of kids. And I know that's really terrible science in terms of quality. And so that very much is the issue this body must consider with respect to this bill, is bringing a halt to these treatments.
When you said that, you used the word questionable, and I'm willing to accept the way you view this. I know you're willing to accept the way that I view it. And so when you have those questions, isn't the best way to bring us to a conclusion about the questions we've got is to place some restrictions on top of it and start to understand and develop more information for us to be able to move forward? We do this a lot.
We do, but I would agree with you with the caveat, which I think is important and that the body understands, and it's part of the reason that I cannot accept this amendment, is that your supposition is correct in the absence of clearly defined harms. But that is part of this conversation, is that we know now. When we talked earlier about this isn't the first time this issue has come before the legislature. It's not the first time this issue has come before any legislature, but there has been an evolution over time with respect to the gender medicine experts used to come and assert to us that everything they did was completely and totally reversible and there were no permanent effects. And then they came later and they said, well, it's mostly reversible. And now we know today that it's completely irreversible. So these are things that are being done to children under the age of 18 that are irreversible, that will cause side effects, complications, and abnormalities that they will have to live with for the entirety of the rest of their life. And I just, unfortunately, respectfully, and I know you and I have talked about this a lot, and I love you like a brother, and I respect you tremendously, but I just don't think this is in the best interest of kids. So respectfully, that's kind of where I am.
Well, I think when we have questions, we should seek answers and not just say no. I appreciate where you're coming from on this, and I just wish we could get to a space where we could continue to understand this, and you use the word evolution, and see where this evolves to. I think that would be important for these families and these kids. Thank you.
I know. Thank you.
The chair recognizes Ms. Johnson to close on the amendment.
Thank you, Mr. Speaker.
Mr. Speaker. Mr. Wu, for what purpose?
Would the lady yield for questions?
Will the lady yield for questions?
Yes.
The lady yields.
Representative Johnson, is your amendment an offer to this body of a less restrictive means to accomplish the same goals as stated by the bill author?
Yes.
Okay. And so what you're asking this body to do is to vote on a system, a slightly different system, which keeps a lot of the bill in place, which keeps a lot of the controls in place, but provide a less restrictive alternative in regulation to this issue. Is that correct?
Correct. This amendment keeps the entire surgical ban in place, and it keeps the vast majority of the ban in place, except in the rare severe circumstance where you have two medical professionals, two mental health professionals in conjunction with the parents and the pediatrician and the oversight of an impartial state agency determining that this care is necessary to accomplish two goals, which is to treat severe gender dysphoria and limit self-harm of the child. That's the very narrow exception that you would be putting in place by adding this amendment.
And this amendment would still address all of the issues that the bill sponsor has laid out, that the bill sponsor says is a very compelling interest, and still addresses those same interests that they say is compelling, correct?
Absolutely. This amendment still allows every issue that your constituents have called you and told you they're concerned about, that you get to say, I took care of that issue, but I made sure that those Texas families in an exceptional position didn't have to leave this state.
And I've heard the bill sponsor say this a few times now, that there is, in his mind, there is no ability to tell what is a severe case and what is a mild case. Did you hear the same thing?
I did hear it, and we know gender dysphoria is a medical diagnosis that has a definition of 6 months. The reason, and look, this was in communication with the entire body. When we said, hey, I think too many people are getting this treatment, then we said, great, let's come up with severe. And severe means you can sit down with parents like Frank Gonzalez, and you have the opportunity for all of these professionals in a state agency to say, when did this start? Did it start as a teenager on social media? Or did it start as a toddler when they can walk into the store and pick the shoes that best represented their identity at the age of 3? This bill allows those families to be heard and medically treated.
And so what I take away from the bill sponsor's answer and that response is that there could be mild gender dysphoria, there could be higher levels of gender dysphoria. Would you agree with that?
No, and let me be clear about this. I think there is, as our community knows, as an LGBTQ community, most of you always know who you are, but there comes a point in time where you tell everybody else. And so gender dysphoria is when somebody knows who they are. What we're trying to recognize here in severe is to recognize those families who have been open, authentic, and their kids have a strong relationship with them, and they are asking for emotional, mental, and medical help. We are trying to find a path for those of you that have countlessly come and tried to knock on the doors of these members to say, I exist, my child exists, I love them, and we are doing everything that we can. Please don't shut us off from our doctors. Please don't shut us off from our state and our home.
And so the offering of this amendment, is there a recognition that there may be some cases that if 5 doctors agree to it and say these doctors agree to it, this child definitely needs this treatment, that this would provide that option?
Yes, if you adopt this amendment, it means some teenager can't go into a clinic and say, can you give me hormones? Because I've heard that concern, that hormones are handed out like Pez. This amendment eliminates any of that concern because you would have the child with their parent, with their pediatrician supervision, 2 medical professionals independently, 2 mental health care professionals independently, that then submit that file to an impartial board created by the state to say that in this circumstance, we believe that this is the best and only course to allow this child to be healthy and allow this family to remain in the state.
And finally, just saying the original bill before your offering of the amendment, a blanket ban would not be, what would we say, the least restrictive way to handle this?
A blanket ban is something we haven't done. We didn't do it for lobotomies. We didn't do it for opioids. I'm going to use those examples because that's what he used. He gave you the call to arms of why we needed to respond, but you didn't respond to any of that in the manner in which this bill would totally eliminate a population of Texans and their families.
Mr. Martinez-Fisher, for what purpose?
Mr. Speaker, will the lady yield for questions?
Will the lady yield for questions?
I will.
The lady yields.
Thank you, Mr. Speaker. Representative Johnson, I'm going to pick up where Representative Wu left off. I mean, my concern is I'm sort of listening to a policy that's more like a because I said so policy. And I look at your amendment and it's, well, it doesn't have to be that way. Here's a very complicated path to treat, a very narrow population with severe gender dysphoria. And I'm just curious from your perspective, I mean, it's a pretty high bar.
It's the
Was
highest.
there any, go ahead.
It's the highest. I mean, literally, think about it. What if I told you before you could take your kid to get a medical procedure that you had to go through 2 other doctors, 2 other mental health professionals, and a state agency? Nobody would reasonably sign up for that. And that's what I mean by this. The families that are saying, we will do this, it is because they know they are going to have to rip their families apart. Either mom goes with one kid to one state and the other parent stays with the other kid so they can stay in high school, elementary school, or keep running their business. That is the dilemma that these families are facing. They are facing elimination from this state. And my worry is that this entire motivation is not based on good policy, but it's based on good politics.
And I'm also concerned, I mean, we've obviously, the complications of meeting this threshold, I mean, while it's been characterized as a lesser alternative, it's still pretty hard. When it comes to folks of limited means, economic means, folks that don't have reliable transportation, folks that may work between 9 and 5, it's hard for me as a working dad to make it to one doctor appointment for a well check. It seems to be really hard for me to have to do this 5 times. And was there any discussion about that, oh, hey, that's a real consideration, Representative Johnson, we should be sensitive to that?
This lapel pin is actually an earring. And it's an earring that was made by a child who repeatedly comes to Austin to testify against this legislation session after session. These families have already been put through hell. They come at 24-hour notice for a public hearing, and they wait in line for a day just for the chance that they might be heard, and oftentimes they are not. They go everywhere to try to fight for the right for their kids to exist. They will do this. It is wrong for us to ask them to do it, but they will do it. And this is the compromise. This is the unbelievable compromise between the two groups that fill this gallery, to recognize that we're trying to hear both, and we're trying not to eliminate one.
And I'm glad you brought that up, because I think the most overused response on that microphone sometimes is, this is the stakeholders' proposal. This is the solution by the stakeholders. This has been vetted by the stakeholders. You're telling me that stakeholders have come together, not in an easy way, but they came together and said, this is something that could work, and it was just rejected outright?
This has been very fair conversations with my colleagues. This is through a course of honest dialogue with my colleagues on the other aisle to hear and address the concerns that you are worried about from your constituents, so that you can tell them you heard them and you acted in such a way that equally respects my constituents and those who are coming to me. It is, at best, our attempt to reach common ground and to find a way to have people to coexist, because I see this room, and I bet there are a lot of folks that have never talked to each other. And our job is to try to be the ones that can find the common ground.
The lady's time was expired. Ms. Johnson of Harrison's amendment, the amendment is not acceptable to the author. It's a record vote. The clerk will ring the bell. Show Dr. Oliverson voting nay. Show Ms. Click voting nay. Members, you will have time to vote from your desks. Have all voted? There being 58 ayes, 81 nays, the amendment fails to adopt. The following amendment, the clerk will read the amendment.
Amendment by Hinojosa.
To our guests in the gallery, the chair would advise you that expressions of approval or disapproval are not advisable. The chair recognizes Ms. Hinojosa to explain the amendment.
Thank you, Mr. Speaker. Members, this issue is an issue that I learned about from a close friend. When my oldest son was in elementary school, my dear friend, PTA president, came to me once on the school playground and said, I know we're invited to your son's birthday party. Her son and my son were best friends. But I need you to know something. My oldest has just come out as transgender. We wanted to come to the birthday party as a family. Is that okay? And she had tears in her eyes. And I said to her, of course, your whole family is always welcome in my home. She explained to me that her oldest, who she named for her father, from the time this child drew pictures, self-portraits, drew herself as a girl born, identified as born when the child was born. This was their firstborn son, but always drew herself as a girl. And she struggled, and I saw this whole family struggle with this transition. And she also said to me, I feel safe in our community, but I don't know what this world has in store for my child, and I'm terrified. And so I know this is hard, this is something hard to understand, and I don't fully understand it. I think we're all learning here. And in fact, probably the medical science is evolving, and doctors and experts are learning as well. So what my amendment says is that this legislation will expire in 2026. There's a sunset clause, because what we are doing today is essentially the practice of medicine on the floor of the House. And things change, science evolves, and we owe it to these families and to ourselves to check back in and make sure this is still what we want to do. The stakes are very high, members. When we first came into session, I went out to dinner with my family, went to a Tex-Mex restaurant not far from here. I had a mother come to me and say, I have a transgender daughter. Do we need to leave Texas? I didn't know her. She grabbed my arm. I was with my family. And I saw the desperation in her eyes. And that's what's at stake. This is people's lives. And so I ask that we at least come back, revisit. We put sunset provisions on all sorts of legislation. For evolving medicine, we owe it to ourselves and to these families to do the same. I move adoption.
The chair recognizes Dr. Oliverson in opposition to the amendment.
Thank you, Mr. Speaker. Members, as my colleague stated, this is a sunset provision, so the law would automatically expire in 26. And I would just say respectfully, we change laws all the time in this body, and so I think this is unneeded.
Mr. Rosenthal, for what purpose?
Mr. Speaker, will the gentleman yield for a question?
Will the gentleman yield for
questions?
1 second,
and let me finish my thought, and I'd be happy to. I don't believe this amendment is needed because ultimately, at the end of the day, if there was a reason to change the law, that's what we're here for. And we can do that anytime. If the science was to reverse itself yet again and suddenly point in a direction that this was actually causing less harm and doing more good, which is the opposite of where we are right now, we could pass a law and we could change the law. So I don't feel that it's necessary, and I would ask you to vote against the amendment with me, and I'm happy to yield to my colleague.
Mr. Rosenthal, for what purpose?
Will the gentleman yield?
Yes.
The gentleman yields for questions.
Very good, thank you. Dr. Oliverson, thank you for taking the question. Didn't you say, and while I disagree with the statement, haven't you said multiple times that the science of this is young and disproven?
I'm sorry, say that. Could you repeat the question?
So while I may disagree with the statement, did you not assert on multiple statements in your layout and in these bills that the science on the treatment of gender dysphoria is young, disproven, and lacks what you would consider more rigorous study? Is that true?
I think what I said, just to be clear, is that the science on gender dysphoria lacks sufficient high-quality evidence to document its benefit, and that there is a growing list of harms that are now well established and side effects that accompany a patient for life.
So thank you. So you did say it lacks evidence. Can I not interpret that as the knowledge on the science being young, immature at this point?
Well, I mean, I guess it depends on what you would define as young. The original studies
okay, so
that
let me
were
get to the
published
point
on
that I'm
this
trying
were
to make.
published in the mid-90s.
Let me get to the point that I'm trying to make.
Okay.
If it is that you feel like we lack more rigorous study, why wouldn't you want to put in a mechanism where we would come back systematically and check up on what's happening?
Because I think it's unnecessary, Representative. Normally, when we do sunsets, we're doing sunsets on state agencies for major programs. If there's a reason for us to be doing this today, which I argue that there is,
So
and then there became new information, and over time the law was no longer necessary, we can always repeal the law. We don't have to put a sunset on every single law that we pass. It's not necessary to sunset a law in order to repeal it.
So I'm going to assert in this next question that the Greater Medical Society disagrees with some of the statements that you are making over and over here, and saying that there's mounting evidence that it does more harm than good, when in fact the American Medical Association strongly in support of these types of care. So given that we're operating outside of the recommendations of a body of expertise, I don't understand why you would disagree with putting in a mechanism to ensure that we come back later and assess if we're actually doing more harm than good.
Respectfully, Representative, I don't think we are operating outside the body of expertise. So
Well,
I know you disagree with that
thank you for taking
assertion,
my
and
questions.
reasonable
Thank
people
you,
can
sir.
disagree. Thank you.
The chair recognizes Ms. Hinojosa to close on the amendment.
Mr. Speaker and members, yes, we could, without a sunset clause, come back and address this legislation later. But with respect to the body, we don't always focus on what we should focus on. This would force us to make a commitment today that on an issue of evolving science, evolving medicine that changes daily, that let's give it a few years, 2026. My guess is there'll be all sorts of developments in science and medicine when it comes to this issue. Let's make a commitment today that we will revisit this issue and examine the science and the medicine to make sure we get it right. Move adoption.
Ms. Hinojosa sends up an amendment. The amendment is not acceptable to the author. The question occurs on the adoption of the amendment. This is a record vote. The clerk will ring the bell. Members, you will have time to vote from your desks. Have all voted? There being 57 ayes, 81 nays, the amendment fails to adopt. The following amendment, the clerk will read the amendment.
Amendment by Wu.
The chair recognizes Mr. Wu to explain the amendment.
Thank you, Mr. Speaker. Members, as the bill sponsor has laid out repeatedly, this is meant to only affect minors who are unable to make their own decisions because they're not ready to make their own decisions. This legislation does not affect adults. So the legislation left off one very important group of people that should have been considered, and those are emancipated minors. And these are minors who have gone to court, and a court of law has decided that they should be free from the restraints of minority, and they should be able to make their own legal decisions. This bill has left them out. These are individuals that a court of law has decided that they have the full rights as an adult to make their own decisions, including health care, including contracting, including everything else that an adult is able to do. That's it. So it's very simple. If we are saying that this should not affect adults because they cannot make their own decisions, then we should adopt this amendment because emancipated minors are also able to make their own decisions. If we do not take this, then we will have people who will fall into a gap in this law.
Mr. Schaefer, for
The
what
gentleman yields for
purpose?
some questions.
Sure.
The gentleman yields for questions.
Representative Wu, what age of an individual are you referring to?
I'm sorry?
What age are the individuals in your amendment referring to?
Age of individuals under 18 who have been emancipated by a court of law.
Okay, so what do you think a typical age would be?
Generally around 16 to 17 in my personal experience.
Okay. And you think they're able to make those medical decisions on their own?
Yes, a court of law has decided that they can make those decisions on their own, including contracting, including other decisions that we generally reserve for adulthood.
What about things like that they could do to their body, like smoking?
I don't know.
Well, we had a bill up here in the legislature where we raised it from 18 to 21. Didn't you say that that 18-year-old should not be able to smoke?
And again, I don't know the exact legalities of how emancipation works with whether they can smoke or not under that law. I would have to take a look at the provision that we passed in 2021 on whether or not that overrides an emancipation.
But I'm pretty sure that you took the position that an 18-year-old should not be able to buy a cigarette because they were not old enough to make that decision. But here you have a different view?
Yeah, in fact, the cigarette law that we passed, the tobacco law that we passed, it's not just cigarettes, actually goes all the way up to 21. So, and that's the same with alcohol, and we also propose that people under 21 should not buy assault weapons. But that has not been
just wanted to be
not
clear.
been moved forward, unfortunately. Move adoption.
Mr. Wu sends up an amendment. The amendment is not acceptable to the author. The question occurs on the adoption of the amendment. This is a record vote. The clerk will ring the bell. Show Dr. Oliverson voting nay. Have all voted? Show Ms. Leo Wilson voting nay. Have all voted? There being 56 ayes, 81 nays, the amendment fails to adopt. The following amendment, the clerk will read the amendment.
Amendment by Martinez Fisher.
The chair recognizes Mr. Martinez Fisher to explain the amendment.
Thank you, Mr. Speaker. Members, this is an amendment. It doesn't fix all the problems of this bill, but it shows some compassion to transgender young people who have been diagnosed by a doctor with evidence-based, medically necessary health care. Puberty blockers have been prescribed for decades, and this bill makes clear that there is nothing wrong with puberty blockers themselves. There is an explicit carve-out in this bill to allow doctors to keep prescribing puberty blockers for precocious puberty as they have for decades. This amendment extends that to allow transgender youth who are diagnosed with gender dysphoria to access the exact same medical treatment. This amendment will allow those who are 16 years and up to access hormone therapy if they have been diagnosed with gender dysphoria and prescribed such a treatment by a licensed doctor. The amendment itself, if you look at it, is done with the consent of the child's parent or legal guardian. We've heard lots of debate and what I thought was a very hard amendment to deal with a medical condition. And I just firmly don't understand a policy that just says, we're not going to do it cold turkey, full stop, and not take into account the number of patients that are currently being seen by their provider and there being no relief. I think about it in my role as a parent, if someone told me that I had to stop working to provide for my family, how do I do that? I think about it as we craft policy, that if we're going to take something away, that we have an alternative. And I think here, the only thing I see is that we're just going to shut this down because there's a dispute or a pause or inconsistency in the science. And I get all that. We're not going to agree on policy and science all the time, but what we can agree on is not throwing people under the bus and leaving folks with an outlet, leaving them with a path, giving them some kind of relief that they just can't go to Walmart and get this kind of help. They need to do it with their parental consent, which is something we believe in. They need to do it in consultation with their medical doctor, which is something we believe in. And what I always thought we believed in is that those decisions should be left to them and not us. And that we shouldn't be in a position of judgment. We should be in a position of empathy. We should understand. We don't always agree with our policy choices and recommendations. We don't always agree that we see the world the same way, but we should always agree to be empathetic, as we all are children of God.
Mr. Speaker,
Ms. Howard, for what purpose?
would the gentleman yield?
Will the gentleman yield for questions?
Yes, sir, I
The
will.
gentleman yields.
Thank you, Mr. Speaker. I'm looking here, I'm trying to look through your amendment and wanted to ask you why you chose to limit hormones to 16 and 17-year-olds.
I mean, it's a tough decision, Representative, because I feel for all of them, but I think that, already there are, cosmetic surgeries and other procedures that 16-year-olds can make that decision. There are a number of medical procedures and in consultation and consent with their parent or guardian that they can move forward. I just figured, okay, we're using that. It's applicable in law as it relates to cosmetic surgeries. For gender dysphoria or severe gender dysphoria, we ought to be able to use 16 and up as a threshold. And it made sense to me based on what we have in current law.
So there are other types of surgeries that 16 and 17-year-olds can get with parental consent currently, right?
Yes, there are. And again, I mean, the one that I keep harking back on is cosmetic surgery. And
Right.
so sometimes there's the medically necessary reason for that, and sometimes there aren't. But again, it's a 16-year-old, it's their parent, their guardian, it's their medical care provider, potentially experts, counselors, making sound decisions based on what is in the best interest of that 16-year-old.
So, I mean, you're talking even about, as you said, cosmetic surgery that is done, rhinoplasty or actually breast augmentation is actually done on minors with parental consent, is it not?
Yes, it is. Yes, it is.
So your amendment, though, would still prohibit all surgeries for transgender adolescents diagnosed with gender dysphoria?
It will. I mean, this is an exception that I'm trying to find, I guess, Representative. I'm trying to find a reasonable path, a less intrusive path. I see the extreme, like we're just going to do nothing. And I guess for all the years I've been here, all the subjects I've worked on, I rarely see a policy that just says we're going to shut it down and do nothing else. This, I thought, could be a narrow exception. We know puberty blockers. We know they are used. They've been used for decades. They're used for precocious puberty. We also know that other medical procedures are being done. 16-year-olds are old enough to participate in the decision-making. There is still parental input, legal guardian input. So putting together, I guess, looking at our medical codes and looking at our public policies, we've already made a value statement that we believe that 16-year-olds should have a say and they're capable and competent to participate in their health care. We still like to have their parents and guardians involved, but we've made a threshold to say in certain instances where we're going to actually have some surgery, we're going to take their input, and we're talking here for puberty blockers that we ought to be able to do the same thing. And again, it's not the solution to countering, we're just going to ban it outright. But I think if I was making an argument to an independent neutral, I'd say, well, if we can't keep the current practice and if going under this proposal to take it away altogether, doesn't this seem like somewhat of a middle ground? and that's what I'm hoping to do with this.
So prohibit the surgeries, but allow puberty blockers and hormones to continue when medically necessary, with the parental involvement and with the physician saying it's medically necessary.
Yeah, and yes, and just, I mean, let's get off of puberty blockers. Let's talk about testosterone or something else. I mean, there are other hormones that are being prescribed to young adults. And again, it's the same concept. I'm not so sure that what is so specific and abnormal about this hormone therapy that all of a sudden we have to just stop with the way we treat everybody else and say, okay, that may work for testosterone, that may work for cosmetic surgery, but for precocious puberty or for or gender dysphoria, wait a minute, we just can't do that. And that's where it just doesn't pencil. It doesn't pencil for me. And so again, I mean, I'm not trying to make up the policy. I'm trying to see, well, what are we doing in other instances? And if a hormone is a hormone, why don't we just set that threshold and that baseline and allow these individuals to get, in these circumstances, get, the puberty blockers, hormone therapy.
Thank you.
Thank you. Mr. Speaker, I move adoption.
The chair recognizes Dr. Oliverson in opposition to the amendment.
Thank you, Mr. Speaker. Respectfully, I'm going to oppose this amendment. This lowers the age, removes puberty blockers from the bill, and asks you to oppose the amendment with me. Thank you.
The chair recognizes Mr. Martinez Fisher to close on the amendment.
Thank you, Mr. Speaker. I have tremendous respect for Dr. Oliverson. We've worked together on policy on a number of subjects. We often sometimes start in a different place, and we ultimately end up in a place where we can find some pragmatic policy. And if I understand the argument is we can't do this because it just lowers the age of what I proposed. But the most important part of the debate is the why. I mean, why can't we do that? I mean, I can understand I'm a reasonable person, I'm a rational person. I don't get to make the decisions all by myself, but I typically would hope to have a little bit more than because I said so as a response. I'd like to know why. I'd like to know, well, okay, is 16 not appropriate? Well, what about 16 and a half? What about 17? What about in a case of life or death? I would think that, as we often say, with 254 counties, 30 million people, 2 time zones, not everything we do fits for everybody. We can't have a one-size-fits-all, but that seems to be the policy here. And maybe I could accept it and respectfully disagree if we're just trying to do something new, but we are not. And so that's the part where I have to wonder or question the policy proposal, the policy choice, that rather than maintain a level of consistency and look to the area of medicine where 16-year-olds do have an opinion that will be taken into account, and to know that we are providing health care at that level and at that age, that we're not doing it here. And so I hope that when you take this vote, you're not taking this vote because we're just going to back up the author because you'd rather not lower the threshold. I hope we take this vote because you think, well, Trey's just wrong. We don't think 16-year-olds should be making this decision. Trey's wrong. We don't think that a 16-year-old and their parent and guardian should be making this decision. Trey is wrong. We think that the best approach is just to wipe it out altogether, and there is nothing that we can do that is less intrusive, that is perhaps a little bit more reasonable and less erratic. If you take that position, well, then certainly don't support the amendment, but please just don't do it because, sometimes we make policy for the worst reasons. That's because we can, and sometimes that hurts people, and I think it'll hurt people in this instance. And so I'd ask you to vote yes on the amendment. I'm asking for a record vote.
Mr. Martinez Fisher sends up an amendment. The amendment is not acceptable to the author. The question occurs on the adoption of the amendment. This is a record vote. The clerk will ring the bell. Show Dr. Oliverson voting nay. Show Ms. Click voting nay. Show Mr. Martinez Fisher voting aye. Have all voted? There being 56 ayes, 81 nays, the amendment fails to adopt. The following amendment, the clerk will read the amendment.
Amendment by Moody.
The chair recognizes Mr. Moody to explain the amendment.
Thank you, Mr. Speaker and members. For so many transgender youth, This health care is the difference between life or death. Access to this health care is shown to improve mental health and reduce suicide rates in those same transgender youth. Medically necessary care is an established doctrine in medicine that healthcare providers take seriously. Gender dysphoria is a recognized medical diagnosis, and without this necessary and life-saving treatment, there is increased risk for mental and physical harm. This amendment would allow transgender youth access to this health care if their provider deemed it medically necessary for the patient. This would also allow doctors to make the best medical decisions for their patient and offer them treatment that they require. This amendment would allow children diagnosed with gender dysphoria that without treatment would suffer severe physical, mental, and psychological harm to have access to the treatment they need. And I move adoption.
Ms. Morales-Shaw, for what purpose?
Mr. Speaker, will the gentleman yield for a few questions?
Will the gentleman yield for questions?
Sure.
The gentleman yields.
Rep. Moody, had you heard the recent statement from the American Academy of Pediatrics? Our organization strongly oppose any legislation or regulation that would discriminate against gender diverse individuals, including children and adolescents, or limit access to comprehensive evidence-based care. Any discrimination based on gender identity or expression is damaging to the socio-emotional health of children and families, as evidenced by increased risk of suicide in this population. Our organizations also oppose any action that would interfere with the physician-patient relationship and with parental involvement in making medical decisions for their children.
Yes, I've heard that statement.
And following up on that, what are the benefits, or if you can name a few of them, of allowing these children to continue with the care?
Look, as I stated, this care in many ways has been considered life-saving, and there are medical organizations that have been on record stating that, and this amendment is going to allow what we know as an established doctrine in medicine to sit over the top of this type of care. And so when someone uses medically necessary care, that is a known doctrine and one that is taken seriously, and I think provides the proper guardrails around this care.
Rep. Moody, we've heard a lot already about the effects on families. Did you want to add anything to that about, I know I've heard from families personally about how this would drastically affect them and how harmful it is to what they think, what their future of their family and their children looks like without this kind of medical care. Can you add to that of people that you've heard from?
Representative, I've probably sat with some of the same families that you have, and it's we sit with a lot of folks in our office and we talk about a myriad of issues, and a lot of times, you'll get kind of in a routine and you say, well, I know how you feel, I know how that is, I know. The truth of it is, the fact of it is, when I meet with these families, I can't say that. I don't know what that is. I don't know how that situation is. I don't know how they feel and how scared they are. I can certainly listen and hear them and try to empathize, but I don't know what it's like to be in their shoes when the entire state is telling them that they need to leave. That's a very difficult position to be in, but it is one that I need those folks to know that I know you and I have seen them, and many of our colleagues have seen them, and that we hear them and that we care about them. The dialogue around bills like this can be dangerous just in and of itself, and so that's something that has been impressed upon me time and time again by those families, both visiting from around the state and those I've visited with in El Paso.
Does the weaning off language that's in this bill address your concerns?
No. It's woefully inadequate.
Can you tell us a little bit about why? And I mean that by sharing with the body, because a lot of the people who are in here today don't have direct experience with what the families go through with their children.
Well, I think the problem with that portion of the bill, which isn't necessarily touched by this amendment, is that it keeps, it's going to necessarily have, medically problematic outcomes. We do not know exactly what that's going to look like going forward. And so we had a better version of that at some point when this legislation was being considered, and I think that's something that this body should consider as well.
Well, I hope while you're up there, you'll talk about your knowledge of the serious physical, mental, and emotional harm that will come by banning this kind of health care. Thank you.
Thank you. I move adoption.
The chair recognizes Dr. Oliverson in opposition to the amendment.
Thank you, Mr. Speaker. Members, with all due respect to my colleague and friend, this is very similar to the amendment that we've considered already for exemptions, and I'd ask you to vote against the amendment.
Mr. Speaker.
Mr. Tallarico, for what purpose?
Does the representative yield for a couple questions?
Yes.
The gentleman yields.
Thank you, Representative Oliverson. Representative Moody's amendment that's before the body would allow parents to give their children this gender-affirming care if it's signed off by 2 doctors. Is that your understanding of the amendment?
That is my understanding, yes.
And you're opposing the amendment?
It's very similar to Representative Johnson's amendment, yes.
And you're opposed to the amendment?
Yes.
Representative Oliverson, is it fair to say that generally speaking in the medical field, there are risks in providing treatment and there are also risks in not providing treatment?
Yes, that is fair to say.
Is it fair to say that sometimes these are difficult decisions?
Yes, I would argue that these are difficult decisions.
Who usually weighs these different risks and makes these difficult decisions?
Well, I think, and again, obviously the short answer to your question is that in this case, because we're talking about minors, that parents are the ones that ultimately have to consent for medical and surgical treatments because we don't allow children this age to make these kinds of decisions. We don't believe that their judgment is mature enough to be relied upon. And quite frankly, Representative, I can't overemphasize the importance of that point because it speaks to one of the serious problems with American practices of gender medicine involving what is known as gender-affirming care, is that it places an extreme amount of reliance on the patient's own self-perception. And for a population that we wouldn't even allow to sign the permission slip to have the procedure. So I think that's counter, that's, in my opinion, that literally runs counter to logic.
And I agree with you that when it comes to minors, these difficult medical decisions are made by the parents.
Right.
The parents usually, especially those that lack medical expertise, rely on who?
Well, they would rely on the physician, and that is where the state comes in. It is the state's obligation to make sure that those that claim to be able to practice medicine and are capable of healing are actually acting in the best interest of the patient. And so that is the whole reason why we have a Medical Practice Act and a medical board, Representative.
Are there any cases where the gender-affirming care that's banned in this bill would be beneficial to treating a child's gender dysphoria?
I do not believe that the treatments that we are removing here are beneficial at all.
So you're saying there will never, in the entire state of Texas, be a case in which the gender-affirming care that's approved by the various associations would be beneficial to treating gender-affirming care?
Respectfully, Representative, scientists don't use the word never or always. But what I was submitting to you is that based on the available evidence and 4 independent systematic reviews of the entirety of the literature, there's no evidence to conclude that this benefits at all.
But so you acknowledge there may be a case in this big state of ours when this care would be beneficial?
I acknowledge that at this time, the science tells us there is no conclusive evidence of benefit, period.
I hear that, Dr. Oliverson. I'm just asking.
I understand that you're trying to get me to say something different, but I go back to what I said earlier. Science doesn't deal in these sort of absolutes. I am telling you, I'm answering your question to the best of my ability based on the science, not based on sort of where we want to go from a legal perspective or from your perspective as a lawmaker. Just please understand, I'm not trying to be evasive, but I'm answering your question based on the science.
Here's my problem is you said medical professionals don't deal in absolutes. You don't want to deal in absolutes, but this bill is an absolute ban on gender-affirming care. Is that correct?
There is no evidence that this is helpful and a growing list of harms.
I just want to make sure you're answering my question. Is this an absolute ban on gender-affirming care?
This is an absolute ban on medical and surgical procedures used for the treatment of gender dysphoria in people under the age of 18. I think that's a more complete answer. I think it's essentially the answer to your question.
Are there doctors in Texas who disagree with you on this?
Sure.
Does the American Academy of Pediatrics disagree with you on this?
Well, I'm glad you brought that up, Representative, because the American Academy of Pediatrics disputes with itself. However, they actually have a bad habit of suppressing their own members' willingness or desire to engage in the scientific debate about this very issue. There were resolutions brought before the House of Delegates most recently at the AAP asking them to revisit their position on this, and the Board of Directors refused to allow their membership to have a scientific debate. So that seems to me very much like shutting the whole conversation down, which is anathema to science.
I just want to ask again, does the American Academy of Pediatrics, in their official position, disagree with you on this?
I think what I'm saying to you is that the American Academy of Pediatrics at this point cannot be relied upon to reliably examine the evidence themselves. Hence, I'm not interested in what they have to say.
You're not interested in what the American Academy of Pediatrics has to say?
I think they have more or less discredited themselves by being unwilling to actually engage in a rigorous scientific debate on their own policy.
I want to talk about this amendment that Representative Moody has brought before us that would allow parents to give this important health care to their children if 2 doctors sign off on it. You said you're opposed to this amendment. I, for one, trust parents and doctors, not politicians, to make these decisions. But I want to see, Representative Oliverson, if you would be willing, I do have amendments to the amendment drafted. If we replace the word 2 with the word 3, so would you allow a child to receive this health care if it's approved by their parent and 3 doctors?
I would not. For the same reasons that I articulated when Representative Johnson laid out her amendment, and that is that there are fundamental flaws in the science underpinning gender-affirming care in America. Hence, I don't think it can be relied upon, no matter how many gender-affirming care doctors agree. Their testimony is not to be relied upon.
Would you allow a child to receive this health care if it's approved by their parent and 5 doctors?
You can keep quoting numbers all night, but I think I've answered the question that there's no number of doctors that would make me comfortable.
There is no number of doctors that would make you comfortable with allowing parents to give this health care to their children. And you're, Representative Oliver, is an anesthesiologist, correct?
I think we've established that already, yes.
And you said that the experts in this gender-affirming care are pediatric endocrinologists?
We heard from them, yes.
And
those are experts.
And you've acknowledged that the Pediatric Endocrine Society disagrees with you on this legislation?
I don't know what their position is on this legislation, but I believe their position is in alignment with WPATH, whose position is to support gender-affirming care, which is not scientifically supported.
And we don't have a pediatrician who serves in this body?
No, we do not.
And we don't have a pediatric endocrinologist who serves in this body?
We do not.
So we have a group of politicians, none of whom, as you acknowledge, are experts in this field, making a decision for the experts. Is that fair to say?
I think our job, Representative, is to represent our districts to the best of our ability.
I think it's clear that this is not about science or medicine, and certainly not about keeping kids safe. I think this is about discriminating against people who are transgender, and I urge you to reconsider your position on the Moody Amendment.
Okay.
Mr. Anchia, for what purpose?
Mr. Speaker, I move that we record the entirety of today's debate on Senate Bill 14 and place it in the record to the extent that motion has not been made previously.
Members, you've heard the motion. Is there objection? The chair hears none. So ordered. The chair recognizes Mr. Moody to close on the amendment.
Thank you, Mr. Speaker. Members, at its base, this bill is about difference, and it's about whether we treat those who are different than us with dignity. It's about whether we hear the voices of those different than us. It's about whether we allow those who are different than us to even exist among us. And this bill, as it came to the floor, gives a very clear answer to those questions. And that answer is no. However, with this amendment, we can change that to give those Texans that might be different than us the dignity that they deserve. I move adoption.
Mr. Moody sends up an amendment. The amendment is not acceptable to the author. The question occurs on the adoption of the amendment. This is a record vote. The clerk will ring the bell. Show Mr. Moody voting aye. Show Dr. Oliverson voting no. Show Ms. Click voting no. Have all voted? There being 56 ayes, 81 nays, the amendment fails to adopt. The following amendment, the clerk will read the amendment.
Amendment by Moody.
The chair recognizes Mr. Moody to explain the amendment.
Thank you, Mr. Speaker. Members, suddenly stopping any medication can have severe, negative, and catastrophic side effects. This bill, as currently written, makes no allowance for and shows no compassion to any person who has already been diagnosed with gender dysphoria and has been prescribed with a medically necessary treatment based on evidence and science. This amendment is very similar to others that we've talked about related to this legislation, and those that would allow for care to be continued for adolescents who had been diagnosed with gender dysphoria and prescribed with medically necessary treatment by a licensed doctor. This particular amendment would replace the weaning off language that is in the bill, that was added to the bill in the House Committee substitute, by taking a simpler, kinder, and more compassionate approach to simply allow people receiving medically necessary care to keep receiving it. The weaning off language added by the committee substitute is woefully inadequate and entirely different from this grandfathering clause. Weaning off still strips away evidence-based, medically necessary treatment for people who have been diagnosed with gender dysphoria. This amendment would at least allow people to keep receiving medically necessary care that they have been prescribed and do less immediate and irreversible harm to young people in our state. This amendment was actually accepted on the Senate side across the building, but then was later rejected with no reason. I was initially, and shockingly, very proud to see my Senate colleagues showing a glimpse of compassion and hope we, too, can add a provision to this bill allowing that care to continue. In fact, we saw in Arkansas, after a bill like this passed, that there was an increase in anxiety, distress, suicidal ideation, and suicide attempts by young people who need this medically necessary life-saving care. And even though the law in Arkansas has been blocked in court by a judge appointed by Donald Trump, that passage of the law still had immediate and catastrophic consequences for Arkansas youth. I want to urge you to vote for this amendment to not immediately harm Texas youth and to allow some of their care to continue when that care has already been determined to be medically necessary. I move adoption.
The chair recognizes Dr. Oliverson in opposition to the amendment.
Thank you, Mr. Speaker. Members, respectfully, my colleague, we're very happy with the grandfather clause. We worked on it, addressed concerns of stakeholders and experts, and so I'm going to ask you to please leave our grandfather clause alone and reject this amendment. Please
the chair
vote no.
recognizes Mr. Moody to close on the amendment.
Look, we talk about evidence. We talk about following it. The evidence is that passing legislation like this is going to lead to increases in suicidal ideation and suicide attempts in young folks in this situation. That's what's happened in other places. That's what's going to happen here. Let's follow that evidence too. I move adoption.
Mr. Moody sends up an amendment. The amendment is not acceptable to the author. The question occurs on the adoption of the amendment. This is a record vote. The clerk will ring the bell. Show Dr. Oliverson voting nay. Show Ms. Click voting nay. Have all voted? Have all voted? There being 57 ayes, 80 nays, the amendment fails to adopt. The following amendment, the clerk will read the amendment.
Amendment by Flores.
The chair recognizes Ms. Flores to explain the amendment.
Mr. Speaker, members, this amendment strikes part of line 22 on page 1 of the bill. This change alters the definition of healthcare provider to clarify specifically what type of professionals this bill is referring to. It cleans up the bill and leaves no room for confusion or vagueness. This would allow for professionals who are not prescribing medications, such as those who offer mental health care or consultations, to still be able to aid children struggling with gender dysphoria. Members, if we are going to rip this life-saving health care away from a population already severely vulnerable to depression, self-harm, and suicidality, then we have a duty to ensure that psychologists and other non-prescribing healthcare professionals are still able to support them both in the course of their lives and in the aftermath of this bill's impact.
Ms. Howard, for what purpose?
Would the lady yield?
Will the lady yield for questions? The lady yields.
Thank you, Representative Flores. I'm looking here. So you're trying to clarify about a healthcare provider because your concern is there's confusion here and it will eliminate the ability of some providers to offer their services?
Yes, correct. The way the bill is written is meant to impact those medical professionals that have pharmaceutical prescribing authority by limiting their ability to prescribe puberty blockers or hormone therapy. But the definition of healthcare provider on the first page of this bill is written vague enough to perhaps unintentionally impact or scare off other kinds of medical service providers that trans teens or teens experiencing gender dysphoria would seek out to aid from, such as a psychologist.
So you're concerned that mental health care providers would be excluded from being able to treat these young people?
Correct, because the object of this bill is to prohibit, either surgeries or procedures or prescription of drugs such as puberty blockers, etc. But this, by having such a broad definition or using the term healthcare providers, that doesn't say, doesn't just limit it to those who prescribe these medications or perform these procedures, that would unintentionally scare off other healthcare providers, such as mental health care providers that can still render services to these children or these teens.
So what would end up happening? What's the outcome for these young people if that's the case?
Well, you can just imagine that if first of all they're taking off these drugs that have been helping them, or they're going to be all of a sudden, if these mental health providers are scared off, as we've seen in other instances, such as when we have in reproductive cases where we have scared off medical providers from performing certain services, it would be detrimental to these kids to not be able to reach out to mental health providers to help them going through these transitions.
Thank you.
Members, please, this bill is very simple. It removes any ambiguity as to who this legislation is truly aimed to regulate or prohibit from either prescribing medications or performing procedures that are enumerated in the bill. So please, let's make sure that we don't unintentionally scare off mental health professionals by including them in this broad term of healthcare providers. I appreciate your support of this amendment. Thank you.
The chair recognizes Dr. Oliverson in opposition to the amendment.
Thank you, Mr. Speaker. Members, respectfully, I'm going to oppose this amendment. Our construct is very, very narrow to the medical treatments and surgical treatments, and so mental health is not in this bill. In fact, we like mental health, and so respectfully, I'm going to oppose the amendment.
The chair recognizes Ms. Flores to close on the amendment.
Members, number 2 on page 1 under subchapter X says healthcare provider means a person other than a physician who is licensed, certified, or otherwise authorized by this state's laws to provide or render health care or to dispense, prescribe a prescription drug in the ordinary course of business or practice of the profession. I am simply deleting the terms provide or render health care so that there isn't any confusion and there is no ambiguity that mental health providers can still continue to provide services to these youth. So please, members, I appreciate your consideration and please vote yes on this amendment.
Ms. Flores sends up an amendment. The amendment is not acceptable to the author. The question occurs on the adoption of the amendment. This is a record vote. The clerk will ring the bell. Show Ms. Flores voting aye. Show Dr. Oliverson voting nay. Show Mr. Frazier voting nay. Show Mr. Jatan voting nay. Show Ms. Click voting nay. Have all voted? There being 56 ayes, 82 nays, the amendment fails to adopt. The following amendment, the clerk will read the amendment.
Amendment by Turner.
The chair recognizes Mr. Turner to explain the amendment.
Thank you, Mr. Speaker. Members, we've talked a lot about how this bill is going to impact physicians today and interfere with their ability to care for their patients. This bill also has the potential to impact pharmacists. So this amendment that I have before you now allows for patients who have already received a prescription for medications to be able to continue to fill those prescriptions after the passage of this bill, if it does in fact pass. This prevents people from having to abruptly stop taking a certain medication, many of which have adverse side effects from spontaneous cessation and severe withdrawal symptoms. Currently, the bill bans provision of best practice health care only in cases that when care is intended to transition a child's biological sex as determined by the child's sex, organs, chromosomes, and indigenous profiles. The same care is given to youth for a variety of reasons, some of which are written into the bill itself. For example, youth experiencing precocious puberty take puberty blockers, as expressly still allowed in this bill, but they also take these medications for other conditions such as acne or endometriosis. The bill, as it stands, would not allow people traveling through the state of Texas to get a prescription filled without putting the pharmacists in danger because they are not familiar with our laws. Pharmacists don't always know for what purpose or exact diagnosis a medication is for when they fill the prescription. And as written, the bill would put the onus on pharmacists to determine for themselves if the prescription they have is for transition-related purposes, since these treatments are only banned for transgender youth, and even then, only when used under certain best practice circumstances. This is a recipe for discriminatory enforcement and could lead to pharmacists denying legitimate prescriptions to patients. I move adoption.
The chair recognizes Dr. Oliverson in opposition to the amendment.
Respectfully, to my colleague, I'm going to request that you oppose this amendment. This is similar to other amendments that we've talked about already today. Do have tremendous respect for Representative Turner, Chairman Turner, but respectfully, I'm going to ask you to vote no.
The chair recognizes Mr. Turner to close on the amendment.
Well, I would agree with Dr. Oliverson that this amendment is similar to other amendments in the extent that these amendments are all designed to mitigate the tremendous damage and harm that is being done by this bill. However, this amendment is different. This amendment speaks very narrowly to pharmacists to ensure that already prescribed medications can continue to be administered so that people don't have adverse side effects from abrupt cessation of taking medications. So I would ask that you vote for this amendment.
Representative Turner sends up an amendment. It is not acceptable to the author. Question occurs on the adoption of the amendment. It's a record vote. The clerk will ring the bell. So Dr. Oliverson voting nay. Show Representative Shine voting nay. Have all voted? Being 57 ayes and 78 nays, the amendment fails to be adopted. Following amendment, clerk read the amendment.
Amendment by Tallarico.
Chair recognizes Representative Tallarico to explain the amendment.
Thank you, Mr. Speaker. Members, this amendment would keep doctors from violating their Hippocratic oath and the principle to, quote, first do no harm. You may know that doctors take the Hippocratic oath during medical school, and it's a core tenet to the practice of medicine in this state. Doctors have come to me and said that this bill would force them to violate their sacred oath. And I think we can all agree that doctors should not be asked or required to violate their professional ethics. Doctors must weigh the risk that a given course of action will hurt a patient against its potential to improve the patient's condition. This is why we can't just use WebMD when we're sick. Doctors are trained to use their judgment and their expertise to follow their Hippocratic oath. All my amendment says is that this bill cannot violate the sacred oath that doctors swear before the public and before God. Members, I hope we allow our doctors to use their training to keep us healthy.
Mr. Schaefer, for what purpose?
Will the gentleman yield for some questions?
Will the gentleman yield for questions? The gentleman will yield.
Representative Tallarico, your amendment requires doctors to follow their Hippocratic oath, which is...
Members, it's very hard for the members on the front mic and back mic to hear each other. Please take your conversations outside the room.
Hippocratic oath calls on physicians to do no harm, correct?
That's right.
And you want physicians to follow the science on this, correct?
On this amendment, I want doctors to follow the oath they swore to God, to do no harm to the patients they're supposed to be treating.
And would you agree that if they're following the science, then science is not going to lead them to harm children?
Dr. Oliverson and I just had a conversation from the back mic to the front mic that doctors have to weigh the risks of providing treatment and the risks of not providing treatment. Dr. Oliverson acknowledged those can be difficult decisions. He also acknowledged that there are doctors, especially doctors who are trained professionals in this field, pediatric endocrinologists, who believe that gender-affirming care, in some cases, does more good than harm. And that's what we want doctors to use their professional judgment to make these calls.
Well, you use the phrase gender-affirming care. How many genders are there?
So gender, as you and I both know, is something that the medical profession acknowledges is a spectrum. We both have talked about intersex people, those folks who are born without clear male or female either chromosomes or genitalia. And so how gender is defined can be very difficult, and doctors and medical professionals acknowledge that.
Well, how many sexes are there?
There are, in terms of chromosomes, there are 2 sexes.
Yeah,
intersex, Representative Schaefer.
Intersex is a rare genetic disorder.
Well,
but wouldn't you agree that if a person was born with one leg, we would still say that the normal thing for humans is to have 2 legs, correct?
Well, Representative Schaefer, you said it's rare. It's actually the amount of people in the world who have green eyes is the same as the percentage of people who are intersex. So it's not as rare as maybe folks would like to think. And so,
by analogy, you would say also if a person was born with one arm or one leg, it's still the normal thing for a human being. We say that humans are bipedal, correct?
I would say that person has one leg, and I would acknowledge that disability. The point of this amendment, Representative Schaefer, is that doctors, the folks that we trust to make decisions about a person's health care in consultation with the patient, and if the patient is a minor, with their parent, should be allowed to follow their professional ethics. And in this case, that's the Hippocratic Oath, which, as you've already agreed, the first principle is do no harm. If a doctor evaluating the case, evaluating a patient's needs, evaluating the parent's input, decides that gender-affirming care will do more harm than good, then they would follow their Hippocratic Oath in not providing that care. But if that doctor, in evaluating the specifics of the case, believe that not providing that gender-affirming care would do more harm than good, then that doctor would provide that care. Go ahead.
If a patient came to the doctor and said, I want to change my sex, then the doctor should say, well, you can't change your sex because there are only 2 sexes.
If that patient is experiencing extreme gender dysphoria, which Dr. Oliverson has already acknowledged is a real condition, then that doctor has an obligation, a moral obligation, according to their Hippocratic Oath, to ensure that that patient, whether it's a minor, in consultation with their parents, receives the treatment that they need. And Representative Schaefer, the consequences of not providing that treatment can be dire. Dr. Gonzalez earlier, when laying out her amendment, talked about the rates of suicide among minors and adults who are experiencing extreme gender dysphoria.
But that doctor, in order to give proper health care, if a child comes to him or her and says, I want to change my sex, then that doctor should tell that child that you cannot change your sex because there are only two sexes and you cannot change a person's sex, correct?
We've talked about the gender dysphoria is different.
You're using the term gender dysphoria, but would you not agree that a person cannot change their sex?
Representative Schaefer, I'm not making up the term gender dysphoria. It's a real condition, one that Dr. Oliverson has acknowledged, and the consequences of not treating gender dysphoria can be suicide.
Simple question.
And Representative Schaefer.
Simple question. Can a person change their sex?
I'm answering your question. Before this bill was filed, there was plenty of evidence that not treating extreme gender dysphoria can not only lead to suicide, but can lead to psychological and physical harm to a child.
Okay, but
and since this bill is filed, the New England Journal of Medicine released a study of 350 young people with gender dysphoria who were receiving hormonal therapy, and it showed that therapy reduced anxiety and depression among those minors receiving that therapy. I'm asking us to follow that evidence, follow that science, and I'm disturbed that this body is not willing to let doctors make these decisions.
I'm asking a very straightforward question. Can a doctor change a child's sex?
A doctor can treat extreme gender dysphoria.
You're not answering the question. I'm asking you, can a doctor change a child's sex?
The different treatments that a doctor can provide can include hormonal treatment.
But can those hormonal treatments change a child's sex?
The hormonal treatments that are provided by a physician are here to treat extreme gender dysphoria.
I don't understand why you keep avoiding the question.
Because I'm trying to
Sex
answer.
has a very defined definition in science, and so I'm asking you, if we're following the science and we're asking the doctors under your amendment to follow the Hippocratic Oath, can a doctor follow the Hippocratic Oath and tell a child that if I give you something that causes you to be chemically castrated, that you can change your sex?
If a child, in consultation with their parents, with the consent of their parents, meets with a doctor and asks how to treat the gender dysphoria that they are experiencing, a condition that we've all acknowledged is a real condition, that doctor has a moral obligation, according to their Hippocratic Oath.
I will stipulate that there are medical treatments for gender dysphoria.
But
are there treatments
Schaefer,
that can change a child's sex?
Those treatments that you just acknowledged are banned under this legislation.
No, those are mental health treatments.
You're not allowing doctors to make these decisions.
Those are mental health treatments. So my question for you is straightforward. Can a doctor do anything medically, through counseling, through surgery, through medication to change a child's sex?
A doctor, through treatments that we have discussed, that you just acknowledged, can treat a child's gender dysphoria, which is the condition that we're discussing in this bill.
Can I ask it a different way? Can a person's sex be changed?
A doctor, in consultation with parents, according to the science that we just laid out, is able to treat, proven, not just from what I'm saying, not just from what Dr. Oliverson has said, but according to the experts, including the Academy of Pediatrics, has said that these treatments that we're discussing under this bill can treat that condition, which we've all acknowledged is a real condition. I guess what I'm
You're not answering the question, but let me ask a different question. So if this biological, if a female comes in, 16, 17 years old, or let's do it this way. Let's say a male comes in, says that he has gender dysphoria, believes that he is a female. Can that person,
that's gender dysphoria, which we just described.
Could that person get pregnant?
The gender dysphoria that you just described can be treated, and it can be addressed through the either hormonal treatment, whether it's the treatments that have been approved by the American Medical Association, the Academy of Pediatrics.
But if that 16-year-old boy tells the doctor, I want to be able to have babies someday, what would the doctor say?
The gentleman's time has expired.
Mr. Speaker,
Mr. Speaker.
Mr. Doorkeeper.
Mr. Speaker, I have a messenger from the Senate at the door of the House.
Admit the messenger.
Mr. Speaker, I'm directed by the Senate to inform the House that the Senate has taken the following action.
Thank you very much. Chair recognizes Dr. Iverson to speak against the amendment.
Thank you, Mr. Speaker. Members, I respectfully ask you to oppose this amendment. If these doctors were following the Hippocratic Oath, this bill would not be necessary.
Mr. Speaker.
Representative Tellerico, for what purpose?
The gentleman yield for questions.
The gentleman yield for questions.
Yes.
Thank you. Thank you, Representative Oliverson. Did you take the Hippocratic Oath when graduating from medical school?
You don't take the Hippocratic Oath typically when you graduate from medical school, Representative, or at least we didn't where I graduated, but obviously it's something that we try not to do any harm. So, and actually the Hippocratic Oath, as I understand it, doesn't say do no harm, it says something different actually, but I think we commonly accept that the Hippocratic Oath means to do no harm.
And you, in your practice, you follow that principle, the
Always
Hippocratic
try
Oath,
to, yes.
to do no harm. Are there doctors in Texas who believe complying with your bill would violate their Hippocratic Oath?
I suppose there are.
So there are doctors in Texas who believe that your bill would require them to do harm to their patients.
I think based on their understanding of the medicine that they're practicing, that is true. However, I would submit to you that the bill before the body asks the very question of whether they are following the Hippocratic Oath. And I would conclude that they are not.
And you've acknowledged
so that is why the state must step in, Representative. You ask a really important question. This is why this bill is necessary. If these doctors were following the Hippocratic Oath and were following the science, this wouldn't be happening and this bill wouldn't be necessary.
And you've acknowledged that in this body there are no content experts. In other words, there are no pediatricians, there are no pediatric endocrinologists who serve in this body. So it is a body of non-experts, according to what you've defined as an expert in this field.
Representative, I think that could be said for a lot of things that we do in this body, and we work on policy all the time, and that we are not experts on. But
Agreed, and we usually
experts.
rely on the experts in order to
Yes.
make decisions.
Yes, and the
on,
experts
on areas that we're not experts on.
And the experts came, as you probably no doubt have heard, and offered testimony. The experts' testimony was considered, not just here, but also in the Senate.
So a body of non-experts are requiring that the experts violate their professional ethics and their Hippocratic Oath to do no harm.
This body is a body that is responsible for promulgating laws in order, in this particular case, in order to make sure that those who practice medicine, who practice healthcare in this state, are doing so in a way that does no harm. That is what you asked me earlier.
Last session,
and so that's what we do. We pass laws to ensure that that is in fact the case, just like we would pass a law against drunk driving.
Last session, you authored legislation which would allow doctors to refuse to provide care for, quotes, reasons of conscience. Is that correct?
Representative, I'm here to talk about this bill.
And in that bill, you defined the term to include a moral philosophy or ethical position. Is that correct?
We're talking about this bill and this right here.
Are there doctors in Texas who believe complying with your bill here will force them to violate their professional ethics?
I'm sorry, say that again.
Are there doctors in Texas who believe complying with your bill will force them to violate their professional ethics?
I can't speak to what other doctors would think or believe or whatever reason.
So why would you support a bill allowing doctors to refuse treatment because of these objections, but not to allow treatment because of these objections?
Well, I would submit to you that what you're talking about, which is a separate matter from what we're discussing here today, has not passed. So we have a legislative process, Representative. My opinions aside, I think it's important to understand that this is a deliberative body that examines issues carefully, and the best ideas make it to this House floor for a public debate and for a vote on that board, and that is the issue before us.
I just want to summarize that you've agreed that there are no experts in this body, and that by passing this bill, we are asking those experts to violate their professional ethics.
I think we've already...
Thank you for answering my question.
Okay, thank you.
Chair recognizes Representative Tellerico to close on the amendment.
Thank you, Mr. Speaker. Members, I hope the conversation that we've had on this amendment and the dialogue between Representative Oliverson and I disturbs you, because if there are no experts on this area in this body, and there are experts who are telling us that this bill will violate their professional ethics and their Hippocratic oath, then we should adopt this amendment that protects those experts, protects those professionals, and says nothing in this bill will force them to violate their Hippocratic oath.
Mr. Speaker,
Representative Sweener, for what purpose?
will the gentleman yield for some questions?
Will the gentleman yield for questions?
I yield.
The gentleman yields.
Representative Tallarico, I was troubled by your exchange with Representative Schaefer and some of the gender essentialism he brought up, and so I wanted to ask you a couple questions about that. You know, as you know, I'm a mom. Being a mom is a big part of who I am. Do you think the women on this floor who are not mothers are any less women than I am?
I do not.
Do you think that it is offensive to women, whether cisgender or transgender, to reduce who we are to our ability to reproduce?
I believe it is deeply offensive.
Representative Tallarico, you are not a father. Are you any less of a man because you're not a father?
I don't believe so.
I would agree with you. Representative Tallarico, do you see this same continuing pattern of really trying to identify women by our reproductive identity and restricting our reproductive abilities as tied to the same determination to discriminate against transgender people?
It disturbs me greatly. This bill, I think, is the most dangerous bill that's being heard on this floor this session.
And thank you, Representative Tallarico. I think we should all agree that whether or not we have had children and our genitalia are not the most important parts about who we are, and that other things are much more important. So thank you.
I agree. And Representative Wiener, you know, being a man involves a lot more than your genitalia. I know single moms in this state who are much more of a man than some deadbeat dads in this state. And I would hope that all of us here could acknowledge that experts and doctors, in consultation with parents and patients, should be making these intensely personal health care decisions and not politicians here in Austin.
Thank you, Representative Tallarico. I agree.
Thank you. Mr. Speaker, I move adoption.
Representative Tallarico sends up an amendment. Dr. Oliverson. The amendment is not acceptable. Dr. Oliverson, record vote. Question occurs on the adoption of the amendment. It's a record vote. The clerk will ring the bell. So Representative Swanson, nay. Dr. Oliverson, nay. Have all voted. There being 56 ayes and 82 nays, the amendment fails to be adopted. Following amendment, the clerk will read the amendment.
Amendment by Angia.
Chair recognizes Representative Anchia to explain his amendment.
Thank you, Mr. Speaker and members. This is a fairly simple and straightforward amendment. The bill, as it currently is written, unfairly discriminates against transgender youth in the state of Texas by making care for them illegal. Care that others who are similarly situated are able to receive. So if it is truly the intent of this legislature and the bill author that this bill not intentionally discriminate against trans youth, then we want to be explicit. So this amendment simply makes it clear that we do not stand for health care discrimination in the state of Texas. And I move adoption.
Chair recognizes Dr. Oliverson to speak against the amendment.
Thank you, Mr. Speaker. Members, with due respect to my colleague, I believe that the appropriate care for gender dysphoria is mental health treatments, not drugs and surgeries, which have not been proven scientifically to show benefit and have a growing number of healthcare complications associated with them. So with respect to my colleague, I think that the best way to do that what he wants to do is to actually pass this bill so that these kids will get the health care that they're actually entitled to, which is mental health care, and we can stop engaging in treatments that have not been scientifically proven to be beneficial.
Mr. Speaker.
Representative Anchia, for what purpose?
Will the author of the bill yield for a few
The gentleman
questions?
yields.
Yes, of course.
The gentleman yields.
Are any of the drug treatments that will be banned by your bill able to be used by patients who are non-transgender?
Yes, they are indeed.
Okay. So you do not believe, it is not your intent, that that differential treatment is discriminatory?
No, Representative, because respectfully, those medications are not FDA approved for these conditions. Even the FDA has said that it warned that the use of these medications for the treatment of pediatric gender dysphoria has not been studied and has not been proven safe.
Are any of the drugs that are used to treat gender dysphoria and are used to treat non-transgender children for their specific condition, are those drugs all FDA approved for that treatment?
Yes. Well,
in every case?
Again, all and never are words that we don't like to use in science, but I would submit to you that I think the most obvious example would be precocious puberty, and I would submit to you that the puberty blocker drugs are FDA approved for that treatment. Yes, sir.
But not you would not go so far as to say in all cases that drugs are used to treat transgender children, is there an FDA approval for other uses for non-transgender children? You would not go that far.
I'm sorry, could you, I'm not following you, I apologize.
Where drugs
yes.
are used for transgender children,
yes.
You say if they are not FDA approved, they should not be used for that purpose. Is that a fair statement?
I think I was throwing that out to you as support for my supposition that, yes, I would say that these drugs are not effective treatments for gender dysphoria.
Okay, so that was offered by you as a disqualifier, right?
So what I was saying to you...
Hold on. If I can just finish my question.
I apologize.
So you offered FDA approval as a disqualifier for use in the treatment of gender dysphoria in transgender children. And if I can finish my question.
Sure, go ahead.
Is the entire universe of drugs that are used to treat children for other conditions, is that entire universe FDA approved?
Well, Representative, I apologize. I did not, in what I said, I did not mean to suggest to you that I was saying that FDA approval is a precondition for a drug being used. I think what I was trying to do is submit to you another objective body that I think that you and I would agree has some standing and value, that they were in agreement with me that it was not appropriate to use these drugs for this purpose. So that's all I was trying to say. I was not trying to make
FDA is not the objective standard.
I was not trying to hold the FDA up as the objective standard, other than just to say that in this circumstance, the FDA and I agree that this is not only an off-label use for this particular medication, but according to them, it has not been studied and may pose risk.
Because both you and I have, and I've observed this, have voted in favor of compassionate use programs. We have voted in favor of right to try legislation this very session alone, where there has been no FDA approval. So that can't be the objective characteristic that we're referring to. So I'll try my question again. Are there drugs that are used for the treatment of transgender children that will be banned under this bill that will still be available for treatment of conditions among non-transgender children?
So let me answer your question by saying it this way. These drugs are not appropriate to be used for gender dysphoria in children.
And that's why you're banning them here, correct?
And so what we're saying is, yes, the science
Okay, so yes,
leads us to believe and conclude and is supported by the literature that these medications have not been shown to conclusively benefit and have been shown to harm.
So if I can make your response concise, you're saying it's not appropriate for transgender children, but it may be appropriate for treatment of other children. Fair statement?
It's not appropriate to put somebody that doesn't have cancer on chemotherapy either. I see where you're going, but my point is that what we're saying is that it is not.
Can you
it is
at
not
least answer the
medically
question?
appropriate to use these drugs for this purpose. There are many healthcare conditions where different classes of drugs would be wholly inappropriate according to the science in order to use to treat a condition. So this is not an issue of discrimination. This is an issue of common sense and following the science.
So you don't believe your bill discriminates?
Absolutely not.
Okay, thank you.
Our bill follows the science. Thank you.
Mr. Manuel, for what purpose?
Would the gentleman yield
Will
for
the
a few
gentleman
questions?
yield for questions?
Yes.
The gentleman will yield.
I have a quick question. I know you have brought up, you say you don't think that medicine is a proper use and that you think it needs to be mental health care. What type of treatment would be sufficed that you think is going to actually help children who have gender dysphoria?
So the studies that I have read, Representative Manuel, suggest that psychological counseling or what we call psychotherapy are highly effective in treating gender dysphoria. And actually studies have shown that 80% of children who are treated with psychotherapy and supportive therapy alone, their gender dysphoria resolves by the time they reach the third decade of life. So it is highly effective.
And what about the children who aren't? If you said 80%, what about the rest of those children? What happens to them?
This bill would not apply to them by the time they reach that age. And so at that point, as adults, having fully matured from a neurobiological standpoint and the state having recognized that they're adults capable of making their own decisions, our bill doesn't deal with that.
Okay, and lastly, would conversion therapy be something that would be a part of that?
So, Representative, respectfully, and I do respect you tremendously, I really don't like that term because I feel like that means a lot of different things to a lot of different people and it's somewhat of a pejorative. And the reason I'm saying that to you is that I know for a fact there was a young man who testified both in the House and Senate as a detransitioner, and he told us twice in the House and the Senate that the only therapist who ever helped him in his home state of California was the therapist who helped him to be okay with his sex that he was born as. But his remark to us was, my interpretation of the laws in California is that he broke the law by helping me to come to terms with who I've always been, who I was at birth. By doing that, he believed that that was, quote, conversion therapy. So I don't like that term because I don't think that that's
like it either.
A scientifically accurate
But I'm
term.
asking, is that because it isn't anything? I'm trying to get to the legislative intent and make sure that conversion therapy or whatever you want to call it is not something that is being used against children who have gender dysphoria, however you want to label it. That's why I'm just trying to make sure it's just a license. Who would that person be?
Let me answer your question this way and see if you and I can be in agreement on this. I believe that one positive outcome of treatment for a child experiencing gender dysphoria would be that through counseling and therapy, that their gender dysphoria would completely resolve and they would be okay with who they are.
Okay, and what
would you
kind of
support
counseling?
that?
Yes, I'll just say this.
Because I think that's a great outcome.
I support parents and doctors making their decisions, but at the end of the day, my biggest thing is finding out who actually is going to be able to assist, since we're taking medications that you're saying that you believe are not effective. Some people say that they believe are effective, because the thing is, we have contradicting views, but yet we're just going ahead and rushing and making a decision. It's like, I don't know what to eat, and so you're the parent coming in saying, well, we're gonna eat pizza. So my thing is, what kind of pizza are we eating? What kind of medical treatment? Sure. Where are these children going to be going? What is their ramifications that we can make sure that we are codifying into this law, knowing exactly where these children are going and not going, because whether you like the word conversion therapy, and you know I have a great deal of respect for you, and I'm not trying to be adversarial, but I want to get to the impact, because as I stated earlier with Representative Johnson's amendment, doing this the wrong way causes children to be harmed. And this is not me speaking from an article. This is from a child who tried to commit suicide until he was 27. So this is very real, very serious for me. This is me being in this body since I was 18, listening to debates like this, leaving here feeling like the place where I was supposed to be the most protected was the place where I was the most hated. And it was best for me to not be here and exist. So I want to make sure that these children are safe, and I want to know what is the intent and where are they going to go. That's the only thing I'm asking. And I promise this is not a get your moment, got your run off. I just want to know what is the version, because this is and you know this is the brain.
That's right, I get it.
And children, and we keep talking about them developing, I need to know they're developing brains, they're developing minds. Who's informing that? Because that's vitally important. And that's what I'm trying to get to. So is it therapists? Is it psychotherapists? Is it, whether you like the word or not, conversion therapists? That's all I'm just trying to get to the bottom of.
I understand. And I think that you said a lot, but I think that the short answer to your question is that I think mental health therapy, and I'm not here to pick winners or losers there. The bill actually doesn't deal with mental therapy, and that is intentional, because we believe that has been shown conclusively to be maximally beneficial to a child struggling with gender dysphoria. Now, I want to be honest with you, and you and I are friends. Do I think, and even the best studies out there don't show that 100% of people who are treated for gender dysphoria when they get to the age of 20, that resolves, which is the reason why this bill stops having effect at the age of 18. What we're saying in effect here with this law is that when we're talking about a child who is neurocognitively, developmentally immature, that we do not want to do permanent, irreversible, potentially lifelong damaging treatments on a child when we don't know whether we could save that child, get that child to a point of being comfortable with who they are, with none of that, right? And so I think you and I would agree that it would be highly beneficial for a child that was struggling with gender dysphoria, if that could be treated without drugs and surgery. I think we would agree that would be preferable than undergoing the risks and the possible lifelong complications and the sterility and the dependence on hormones and all of the other problems. You know, when we talked about this bill, in addition to talking to families and other folks, we also heard from detransitioners. We talked to people who were on the other side of this, who made a mistake, who went down this pathway thinking it was going to solve their problems, and it left them broken people.
But not children, though. We didn't listen to, the children have never said that, but I digress. So the main thing is to answer the question, there aren't any guardrails.
This bill doesn't establish best practices for mental health therapy.
So the mental health aspect is just open at this point.
It's not part of this bill, Representative.
Okay, but that's what I'm saying is the treatment version of it at this point is basically going to be all size fits all, because it's not in this legislation, so kind of just figure it out at this point. Like for the mental health aspect of a child dealing with gender dysmorphia is, if your parents want you to go to a psychologist, if your parents want you to go there,
the gentleman's time has expired.
Okay, that's what I want to check.
Chair recognizes Representative Chia to close on the amendment.
Thank you, Mr. Speaker and members.
Mr. Speaker.
I'll take questions after my layout. Thank you. Mr. Speaker and members, I take the gentleman at his word. If he says this bill, his intention is for it not to discriminate, then we should put it in the bill and say that this bill shall not discriminate. And that's what my amendment does. So please vote aye. Move adoption.
Representative Jones, for what purpose?
Will the gentleman,
yield for questions?
I like your...
Does the gentleman yield for questions?
Oh, I'm sorry.
I yield for questions.
He yields. Sorry.
Thank you. So I like your amendment because it says that you won't discriminate or you can't be discriminated against if you're transgender, but also that you can treat gender dysphoria. So it made me think of situations because I've heard people talk about how by the time you're 20, I guess you're cured of whatever. But I think of a client that I had once who was a trans woman, and I had him in court, I had her in court, and everybody didn't understand that she was a woman. So when I was investigating so that I could mitigate during her punishment if she got convicted, I went and I talked to her mom. And I asked her mom, like, how long has she been like this? And her mom says, well, when she was in pre-K and they would line them up to go to the restroom and they put the boys on this side and the girls on this side, even though she was born, I guess a biological boy, she would always get in line for the girls' restroom. And the teacher called mom and said, hey, you need to get your son and get him to get in the boys' line for the restroom. But no matter what she said to her daughter to get into the boys' line, because she was buying into it, because she didn't understand what it was to be a transgender girl, she tried to do therapy. She did all these mental health things to try to cure her daughter from being a transgender girl. And what ended up happening is she had a bunch of psychological issues because people kept telling her she wasn't who she was. And she ended up being homeless. She ended up getting kicked out by her mom. She ended up being on the streets because no one would accept her as a woman. And so she was well past 20 when I had the opportunity to meet her. And so I like your amendment in that it recognizes that there's gender dysphoria, but it also recognizes that there are actually transgender women. Because as a child of a parent who committed suicide because something was going on in his mind, it concerns me that we are not accepting people, at least in this house, for who they are, and whether we want to believe it or not, and we're trying to relegate it to just being mental. I will say this, that I've had two friends who lost their children who committed suicide. One was 11 and one was 16 on his 16th birthday because of the hate that is directed at the LGBT community. So I think that your amendment is great, and I would be curious to know what caused you or led you to draft this amendment that understood that there are some people that have gender dysphoria, but that there are other people who are trans, boys or girls, men or women.
It's pretty simple. I don't believe in discrimination. If we don't want to discriminate, we adopt this amendment and we say that kids can receive treatment no matter who they are, health care no matter who they are, the care that they need no matter who they are. Move adoption.
Question occurs on the adoption of the amendment by Representative Vanchia. A record vote. The clerk will ring the bell. Show Representative Click voting no. Show Representative Alverson voting no. Have all voted? There being 55 ayes and 82 nays, the amendment fails to be adopted. Following amendment, clerk read the amendment.
Amendment by Zwiener.
Chair recognizes Representative Zwiener to explain the amendment.
Mr. Speaker, members, last session when this issue first really hit this body, the conversation was about surgeries. And I don't think you'll find a member on this floor who thinks it is a good idea to do genital surgeries on youth under the age of 18. We do not have a disagreement there. So what my amendment does is take this conversation back to what members of this floor were asking for last session and limit the bill to just affecting surgeries. Members, gender dysphoria is recognized as a serious medical condition and by every major medical association in our country. Yet this bill seeks to deprive transgender Texans of evidence-based, age-appropriate, medically necessary health care. My amendment would narrow this bill so that doctors, in concert with a team that, yes, always includes mental health care providers, could still prescribe puberty blockers and hormones. I want to note, especially with puberty blockers, members, there's been a lot of conversation today about whether or not puberty blockers should be used in ways that are quote-unquote off-label, i.e. in a different way than how the FDA has specifically approved the drug. The most common drug is Lupron, and members, Lupron gets prescribed right now for kids who are anticipated to not add up to the height their parents hope they will. That is off-label, that is not FDA approved. If this legislation was really about trying to protect Texas kids from terrible, medically unnecessary side effects of Lupron, why are we only banning it for transgender youth? We are not. We are also banning other off-label uses that happen right now for people who want their kids to be taller and for people whose kids compete in sports where it's considered an advantage for them not to go into puberty sooner rather than later. So my bill would allow that treatment to continue for youth, just those prescription medications. My amendment fixes this bill so it is no longer unconstitutionally discriminating against transgender youth. And remember, these medications have been prescribed for decades for a variety of medical diagnoses. And while there are side effects, they are side effects that are on par with over-the-counter medications that we have all given our children over the course of their lives. So members, I urge you to support this amendment so that we can allow these medication treatments to continue while only banning surgeries, which again is where this conversation started 2 years ago. So members, I move adoption.
Chair recognizes Dr. Alverson to speak against the amendment.
Thank you, Mr. Speaker. Members, with all due respect to my colleague, respectfully, I would oppose this amendment. She is correct that we are in complete agreement that surgeries on minors for the purpose of gender reassignment is a bad thing, and I think we're in agreement on that. I know we are, but I think the science actually says far more than that. I think it says that, in fact, I know it says that these medications have not been proven to resolve gender dysphoria, that these medications have side effects that we've talked about that are serious, significant, lifelong, irreversible. And you're talking about administering these drugs to someone under the age of 18 before they're fully neurocognitively developed and not capable of making adult decisions, and you're making an assumption that despite the fact that there are permanent, lifelong changes to that person's body that may leave them dependent on these and other medications for the rest of their lives, that how they think or feel about themselves at age 12 or 13 is carved in stone for all time. Because I'm going to tell you something, members, we've studied this, we've looked at this, the science is clear. You start down this pathway and you get to a point where you cannot get back. And I know that's just something I know we'd probably disagree about, so I'm not going to accept the amendment. I think that the drugs are potentially as or more harmful and certainly have significant lifelong effects, just as the surgeries do.
Mr. Speaker?
Representative Sweener, for what purpose?
Will the gentleman yield for some questions?
Does the gentleman yield for questions? Gentleman yields.
Thank you, Representative Oliverson. Representative Oliverson, does your bill ban the prescription of puberty blockers off-label for the intention of trying to get a child to grow to a larger height?
Well, Representative, I'm not sure what you mean by that. Our bill talks about only banning these drugs for the purpose of attempting to change the sex of the child, I think is the exact terminology that it uses. So it's a very specific indication that we're prohibiting these medicines for. But I don't know, you may be referring to precocious puberty, I'm not sure.
So hypothetically, you have a youth not experienced precocious puberty, starting to enter puberty around to ages 10 or 11. Parents hope they have a little more time to grow. Doctors suggest a puberty blocker.
Right. And I think it's important
Does your bill ban that?
No, well, no, it doesn't. But I think it's important we talk about why we give puberty blockers to children. And you mentioned height, but just for the benefit of our guests and other members in the body, I think it's important to point out that one of the dreaded complications of untreated precocious puberty is that it causes
Representative
the bones
Alderson,
to
I'm sorry, I
fuse
just want to make
prematurely.
sure we stay on track. I'm not asking you about a precocious puberty situation.
Okay.
I am asking about a situation where you have, let's say, a young cisgender boy entering puberty, starting to enter puberty at a normal age, but the call is made that he is not projected to be very tall, and they want to delay the closing of his growth plates by prescribing Lupron. As I know you're aware, because we were just discussing some of that evidence during a point of order debate, applications in those circumstances have the exact same side effects you are complaining of as when the medications are prescribed for transgender youth. Does your bill ban using puberty blockers off-label to try and give a child more time to grow taller?
Representative, I hope that people don't use puberty blockers just to change people's height. That doesn't seem to me like a medically appropriate use, but that is beyond the scope of this bill.
So your bill does not address that. Thank you.
I hope nobody's doing that.
There's also been reports of use of puberty blockers for young female athletes, particularly gymnasts, cheerleaders, spaces like that. Does your bill ban the use of these medications off-label to try and extend the career of young teenage girl athletes?
I am not advised that actually is happening, but that sounds highly unethical to me. But unfortunately, that's beyond the scope of this bill.
Thank you.
The chair recognizes Representative Zwiener to close on her amendment.
Mr. Speaker.
Representative Tenderholt, for what purpose?
Will the representative yield for a question?
Representative Zwiener, do you yield?
I will, of course, yield for questions.
She yields.
So if this bill solely did stopped surgeries on children for gender care, you'd vote for it?
If this bill solely stopped genital surgeries for minors without having any discriminatory language in it, I would be happy to support this bill.
So are you aware that puberty blocking medications long-term on children have been proven to cause sterilization?
I do not believe that is accurate information.
It is, and you can find it anywhere. Do you
I believe you can find that on some sites
do you
that
know
are
that
not
the U.S.
well cited.
Constitution has says that individuals have a fundamental right to procreate? They have the right to do that.
Individuals also have a fundamental right to not procreate, and I know I resent my identity and worth being solely linked to my ability to reproduce, and I am not alone in that.
Well,
Folks have a right. I am finishing answering your question.
Of course you are.
Folks absolutely should have a right to reproduce if that is what they choose, but people make choices every day that lead them down different paths in their lives, and this should not be treated as any different.
So do you know when parents give puberty blockers to children and they make them so that they can't have children, which many of them we heard in the committee want to do after they're 20 and 25 years old, you know that can be considered child abuse because a child is not legally competent enough to consent to that sterilization. What do you have to say about that?
That is certainly not current law, and people choose treatments for children every day that potentially have side effects, and medical professionals and parents' jobs are to weigh the potential side effects and pick the best path forward for their children.
Well, I disagree. I think what you're supporting today goes totally against our Attorney General's opinion that was done with former Representative Matt Krause, who's up in the audience. He asked a question. He's in the gallery. And he specifically stated that...
Mr. Speaker, I don't believe we're supposed to
question.
refer to
Don't
people
interrupt
in the
me,
gallery
please.
on bill
Let me
debates.
finish asking the question. So what you're doing and what you're supporting and what your party's supporting right now is termed child abuse. You guys want to abuse children. It is despicable. And I can't fathom why you or anyone in this room would want to abuse young, innocent children by blocking their puberty, giving cross-sex hormones, and harming innocent children. Now, when a child thinks that they're something else that they're not, we get them behavioral health. We get them, we send them to a psychologist. We don't carve them up and we don't give them medicine to stop their puberty and sterilize them for the rest of their life. So I just think it's despicable, and I cannot believe that anyone in this room wants to do harm, physical harm, to children. It's child abuse.
Representative Tenderholt.
Visitors in the gallery are welcome to be here, but we will not engage in demonstration or we will clear the gallery.
Representative Tenderholt, I have had 3 people cry in my arms outside the floor of this building today. I have had 3 people, some of them transgender individuals who feel personally under attack by this body today. People who feel like this body is telling them they don't belong in Texas, the state I and they love. Some of those people were not transgender individuals. Some of those people were parents. Parents who have already sent their kids out of this state to try and protect them. Parents who are trying to figure out what to do right now in the face of the fact that this body inexplicably has become obsessed with them and their children. Members, if you don't think transgender therapy is a good idea, don't have transgender therapy. Don't have gender-affirming care yourself. That option is available and on the table for you today. But leave these families alone. They are parents who are doing every single thing they know how to do to protect and defend their children. That's something I know I would do if I felt like my child was in danger. I would do every single thing I know how to do, and every single one of you would too. So before you judge these parents, walk a mile in their shoes, listen to the stories of parents, many of whom started with political and spiritual beliefs like you have, and were startled and surprised and confused when their child's gender did not line up with the letter on their birth certificate.
The chair would like to remind members that they are not allowed to engage in personalities during the discussion on the front mic and back mic. Ms. Morales-Shaw, for what purpose?
Yes, Mr. Speaker, would the gentlelady yield
Does
for
the
some
gentlelady
questions?
yield? Gentlelady yields.
Representative Weiner, did you have an opportunity to meet with Frank and Rachel?
I have met with Frank and Rachel, yes.
And from your conversations with that couple, who are like every other couple that's in this room, did they describe to you the heart-wrenching experience that they went through with their child and the adjustments that they had to make in the face of gender dysphoria?
Yes, they and many other families have shared their stories with me. One I've been thinking a lot about lately is a gentleman who walked up to me at a polling place last year and told me, I've been a lifelong Republican and I have a transgender teen and I don't know what's happened to the people who I thought represented me, but my family now has a plan for my wife to take my daughter to a different state if bills like this pass. And those are the stories we are hearing every day for parents, which is why it is startling to me that we are not giving those parents more grace right now.
Representative, did you have an opportunity to meet with Annalise, Anna, Ed, Lindsay? Did you have an opportunity to meet with any of those families?
I have met with some of those families. Yeah.
Did you feel that when they were expressing their personal life experiences with their children, that they were expressing that they wanted to harm their child in some way?
No, every conversation I've had with a parent, they are doing everything they know how to defend their child. They're mama bears. There was even a documentary about some of these parents called Mama Bears because they are ferociously trying to protect their child's future. And that's the real difficult space we're in, is we are living in a moment in time where a lot of these children look at debates like we're having on the floor right now and wonder if they have a future. And so what I want those children to know more than anything from today is that regardless of how the vote goes down on this bill tonight, there are people in this chamber who are fighting for them. There are people in the gallery who are fighting for them. There are people in this building who will continue to fight for them and make sure that they have safe places to be who they are in this world.
When they were expressing all of the support that they had to give to their child, did that feel, and when they broke down into tears, did that feel like the same love that you and I have for our children, the love that will make us do anything to protect them, to keep them safe, to understand them, to nurture them and help them grow into the best person that they can be?
Absolutely. If I thought it would protect my child, I think I'd try to pull this Capitol apart brick by brick with my bare hands. And that's what a parent's love does.
And
these are
isn't
parents
that
who
what
are fighting
all of the
the same
advocacy
way.
on the floor is about today? It's about being a voice for a percentage of the population that are not understood a lot of times.
Absolutely. We do not have a transgender individual on this floor being able to be that voice. So
And
it's
do-
our jobs to be that voice
do we
here
have
today.
any members that you know of that are supporting this bill that have ever lived that have ever walked in those shoes, that have ever had to understand that their child might be different, might not be like what they expected?
Not that I'm aware of.
Thank you.
Members, I urge you to support this amendment to allow parents to still have options to support their transgender youth.
Question occurs on the adoption of the Zwiener Amendment. It's a record vote. The clerk will ring the bell. So Dr. Alverson voting no. Show Representative Rosenthal voting aye. Have all voted? There being 56 ayes and 80 nays, the amendment fails to be adopted. Following amendment, the clerk will read the amendment.
Amendment by Rosenthal.
Chair recognizes Representative Rosenthal to explain the amendment.
Thank you, Mr. Speaker. Members, this amendment would clarify the type of care that could be banned by this bill, specifically treatments that cause permanent infertility. By striking the term transient, which in this case means effects that are not permanent, we would only ban the use of medications or treatments that would cause permanent infertility, while still allowing the use of some of the more commonly used medications that treat gender dysphoria and do not cause permanent infertility. I move adoption.
Chair recognizes Dr. Alverson to speak against the amendment.
Thank you, Mr. Speaker. Members, with all due respect to my Harris County colleague and neighboring district, I'm going to oppose this amendment. The language as it's constructed in this chapter is very clear in terms of banning these medications for this specific purpose. And so the word that he's striking with respect to transient versus permanent infertility doesn't really have a significant effect, and it doesn't seem to have any purpose that I can figure out exactly what it would do. So respectfully, I'd ask you to oppose the amendment. Thank you.
Chair recognizes Representative Rosenthal to close on the amendment.
With respect to my, one of my favorite colleagues, actually, I really do like Dr. Tom Oliverson. But with respect, if one of the arguments that we are that he is laying out over and over again is about permanent infertility, this would only restrict the use of things that actually permanently affect children, which is what you have been talking about all along. I move adoption.
Question occurs on the adoption of the Rosenthal Amendment. It's a record vote. The clerk will ring the bell. Show Dr. Alverson voting no. Show Representative Rosenthal voting aye. Have all voted. Being 53 ayes and 81 nays, the amendment fails to be adopted. Following amendment, the clerk will read the amendment. Following announcement, the clerk will read the announcement.
The Committee on Ways and Means will meet today upon final adjournment at desk 41. In a formal meeting to consider pending, referred, and committee business.
Following amendment, the clerk will read the amendment.
Amendment by Garcia.
Chair recognizes Representative Garcia to explain the amendment.
Thank you so much, Mr. Chairman, Mr. Speaker, excuse me. This amendment would offer the other than procedure described by section 161.702, and what this amendment will do is it will greatly impact intersex children. Not all babies' genders are identifiable at birth, and sometimes the liberty is taken to select a sex. I ask that you support this amendment to keep intersex children's rights intact. If you believe in a person having consent for their own bodies, please vote yes for this amendment. I move passage.
Chair recognizes Dr. Alverson to speak against the amendment.
Thank you, Mr. Speaker. Members, I have great respect for my colleague, especially she and I had a chance to visit about this amendment beforehand, and we talked about it. The fact of the matter is that the intersex conditions are abnormal genetic conditions, medical conditions that are verifiable. And so that's not really the subject of this bill. I understand what she wants to do here, but respectfully, we're focused on the use of these treatments and surgeries for children who have normal biology and normal genetics, but we're doing that especially to change that. And so respectfully, I would ask you to oppose the amendment.
Chair recognizes Representative Garcia to close on the amendment.
Thank you so much.
Mr. Speaker. Representative Jones, for what purpose?
Will the gentlelady yield for some
Gentlelady
questions?
yield for questions.
Representative
Yes, I
Garcia.
yield for questions.
How many intersex people live in the United States?
Excuse me. I was on my way out of here. At this point in time, research shows that in the United States today, up to 2 of every 100 people born in this United States are intersexed.
Thank you. And why does this bill explicitly authorize intersex surgeries on infants?
I don't know, honestly. In recent years, professionals in the medical field, doctors, intersex Americans, and advocates for re-examining these surgeries. Many doctors and parents of intersex children feel pressure to make split-second decisions. It's very shocking on them when a baby is born with genitalia that can't be identified.
Thank you. And what are the lifelong effects that intersex people face as a result of these surgeries?
Well, some things that they face are very uncertainty, perhaps feeling trapped in a body that they don't feel is theirs. And this occurs specifically when perhaps a penis is not fully formed and they remove that tissue to make the baby a female. And when in fact that was not the case. The testes that were there at birth that were removed to make the baby appear female greatly affected their excuse me, I lost the word, but it greatly affected them in a way that their hormones did not have the natural mechanism to produce estrogen, which had they had their testes, the testosterone can be transferred over to produce estrogen, which would allow that individual to live a more normal life for them.
So you're saying that this bill as currently written would allow for surgeries to be performed on kids?
Well, It can be, yes, because when we're looking at a situation, especially when it comes to legislation, where we're saying that there's two genders, male or female, and that is all, sometimes it takes them, the parents as well as doctors, they have the knee-jerk reaction to choose one or the other. So we have heard stories of things like this occurring, and actually I'm in contact with an adult who was born intersexed, and what she experienced was part of the story that I shared with you, and we're asking for the opportunity for children to go through their lives to determine what sex that they are.
Last question. Does this bill explicitly allow for surgeries to continue to harm intersex youth?
At this point in time, it does allow for that because there is no clear definition on these procedures. And as Representative Oliverson mentioned earlier, we're trying to put in there that we do not authorize surgery on a baby who is intersexed before they're able to go through their life cycles, because once they become adults and if they're chosen to be of a gender or of a sex that is not compatible with their living in the way that they present, it causes a lot of confusion. It causes a lot of mental anguish and trauma. And oftentimes it does lead to very intrusive thoughts of suicide.
Thank you so much for this amendment, Representative Garcia.
Thank you so much. And I would just like to add as well that this is a very tough topic, and I really appreciate everybody bringing these issues to the table. And I really hope that we can leave this conversation open for further work, and I move passage.
Question occurs on the Garcia amendment. Question occurs on the adoption of the Garcia amendment. It's a record vote. Clerk will ring the bell. Show Dr. Alverson voting no. Have all voted. Show Representative Reynolds voting aye. There being 55 ayes and 81 nays, the amendment fails to be adopted. Following amendment, clerk will read the amendment.
Amendment by Reynolds.
Chair recognizes Representative Reynolds to explain the amendment.
Thank you, Mr. Speaker. Members, according to Trevor's Project's 2023 National Survey on the Mental Health of the LGBTQ young people, 56% of LGBTQ young people who wanted mental health care in the past year were not able to get it, including nearly 3 in 5 transgender and non-binary young people. Additionally, 38% reported being unable to afford mental health services. This bill would effectively strip away any kind of health services to these children. They would no longer be allowed to receive life-saving medication that would help them. Because this state is doing this to the children, and I've seen where the votes are, it is our responsibility as a state to make sure that the harm done to these children is minimal. When nearly 1 in 3 LGBTQ young people say that their mental health was poor most of the time or always due to anti-LGBTQ policies and legislations, this body must provide an adequate substitute for the care that they will be losing through this bill. This amendment will provide free mental health services to help these children and their mental well-being. We've heard the statistics about the depression, about the anxiety, and ultimately, unfortunately, about the high number of suicides. And I ask for your support. I move adoption.
I recognize Dr. Alverson to speak against the amendment.
Thank you, Mr. Speaker. Members, I have great respect for my colleague from Fort Bend County. This bill's not about mental health. We've talked about how we support that. But again, I believe this amendment goes beyond the scope of the bill. Would ask you to vote no, but I appreciate his focus on mental health.
Chair recognizes Representative Reynolds to close.
And I have a lot of respect for my dear colleague, Dr. Alverson, but we often talk about mental health when there's a response to a mass shooting. We often talk about mental health when we see so many issues plaguing our society. And we know, based on the statistics and the pure research, that these individuals are going to have a high need for mental health services. And there is a high likelihood that they won't be able to afford it. We must, as a state, make sure that we're caring for these individuals. Now, I know that this is a highly partisan issue, and I'm going to say this. I am a proud heterosexual male. I have children. I'm a proud Christian. But we must prepare to care for all of these children, and we know that mental health services is real, and that, unfortunately, without those services, we could be looking at an increase in suicide, an increase in dropouts, an increase in drug addiction, an increase in other negative impacts. And that is why this is so essential. If we're going to pass this bill, which I'm voting no, that the least that we could do is to make sure that these individuals have access to the mental health services that they may be rightfully needing. And with that, I ask for your favorable consideration, and I move passage.
Question occurs on the adoption of the Reynolds Amendment. It's a record vote. Clerk will ring the bell. So Dr. Alverson voting no, Representative Click voting no. Have all voted. Being 55 ayes and 80 nays, 56 ayes and 80 nays, the amendment fails to be adopted. Following amendment, clerk read the amendment.
Amendment by Busey.
Chair recognizes Representative Busey to explain the amendment.
Thank you, Mr. Speaker and members. This is mainly a cleanup amendment. As written, this provision could cut off public funding from any entity, organization, business, or person who facilitates this health care, even though that term is not defined. The concern here is that the phrase on page 4, facilitates the provision of, is both undefined and potentially so overly broad as to jeopardize the already fragile ecosystem of healthcare providers and negatively impact businesses and organizations in Texas that provide healthcare insurance to their employees or otherwise take any action to facilitate the provision of care. There is no need to extend this provision to individuals and businesses when the rest of this bill is tailored to healthcare providers. So I hope this amendment is acceptable. It's mainly a cleanup. If you look, it's just very specific, or facilitates provision of. What we're dealing with is entity, organization, or individual, striking and saying healthcare entity or organization. So I hope it's acceptable, and I move adoption.
Chair recognizes Dr. Alverson to speak against the amendment.
Thank you, Mr. Speaker. I have great respect for my colleague, Representative Busey, and I appreciate his concerns. The issue he's focusing on has to do with the section prohibiting the use of public funds to pay for these services directly or indirectly. Members, I think that's an important part of this legislation. I think it was written very carefully. I don't think there's anything wrong with it, and I think it means what it says very clearly, that we're not interested in using public money for these purposes. And so with that, I respectfully oppose the amendment.
Chair recognizes Representative Busey to close on the amendment.
Thank you, Mr. Speaker and members. What this amendment does is just to narrow the loss of public funds to any individual, business, or entity so that is accused of facilitating such treatment elsewhere. This bill is specific to a few items, but this section is written too broadly. I hope you'll stick with me. Let's clean this up so we don't have an unintended consequence, and I move passage. Move adoption.
Question occurs on the adoption of the Busey amendment. It's a record vote. Clerk will ring the bell. Show Representative Leach voting no, Representative Busey voting aye, Representative Goodwin voting aye. Have all voted? There being 55 ayes and 80 nays, the amendment fails to be adopted. Following amendment, clerk will read the amendment. Watch it, Chio.
Amendment by Gonzalez of Dallas.
Chair recognizes Representative Gonzalez of Dallas to speak against to explain the amendment.
Thank you, Mr. Speaker. Members, this amendment simply adds the term "in the state" and ensures that the provision of this bill that prohibits the use of public money only applies when a procedure banned by this bill occurs in the state of Texas. As written, this provision could cut off public funding from any healthcare provider, medical school, hospital, physician, or any other entity, organization, or individual who facilitates this healthcare. This provision is ambiguous on whether facilitation extends beyond the borders of the state. Additionally, the bill fails to even define what facilitates means. This bill could put our local hospitals, businesses, and medical schools at risk of losing funding for their programs businesses or insurance provide the life-saving health care this bill is trying to ban in another state. Not every state agrees with this bill, with the bill author on this issue, and these organizations shouldn't be in trouble for their work outside of the state of Texas. Businesses shouldn't have their ability to contract with the state dependent on what kind of out-of-state coverage their insurance provides their employees to access care. This provision of the bill is very unclear, and this amendment seeks to protect our Texas hospitals and businesses by clarifying that for the use of public funds to be prohibited, the conduct must occur in Texas. I move adoption.
Members, please take your conversations outside the rail. Chair recognizes Dr. Iverson to speak against the amendment.
Thank you, Mr. Speaker. Members, this amendment focuses on the same section the previous amendment focused on. And again, I'm just going to say that what happens outside of the state of Texas, especially with regards to companies and their insurance coverage and things like that, is protected under federal law by ERISA. And so that's not what this bill does. It's not there to tell insurance companies what they can and can't cover in other states and things like that. We're focused on Texas patients and Texas medicine, but we're also concerned about our tax dollars being spent wisely. And so respectfully, I would oppose the amendment.
Chair recognizes Representative Gonzalez to close on the amendment.
Members, again, this language in the bill as it currently is unclear, and this amendment simply seeks to protect our Texas hospitals and businesses by clarifying that the use of public funds be prohibited, that in order for it to be prohibited, that it must occur in the state of Texas. I move adoption.
Question occurs on the adoption of the Gonzalez amendment. So record vote. The clerk will ring the bell. So Dr. Alverson voting no, Representative Click voting no. Have all voted. Being 55 ayes and 79 nays, the amendment fails to be adopted. Following amendment, clerk read the amendment.
Amendment by Goodwin.
Chair recognizes Representative Goodwin to explain the amendment.
Thank you, Mr. Speaker. Members, I believe this is the last amendment, and so I would really appreciate your attention. With each of the votes that we have taken previously,
Members, please take your conversation outside the rails.
With each of the votes that we have taken previously, it's becoming clearer and clearer that we are going to pass this bill without any exceptions, any protections. We have agreed that gender dysphoria exists. We have agreed that it is something that causes trauma and stress and anxiety in our kids. And so I'm very concerned. Other representatives have alluded to the fact that it could potentially lead to suicides or suicidal ideation. So my amendment says that we will keep track of that. We'll gather data. We will see if there are consequences to this new law. This amendment would create a study that would measure suicide rates in kids who are denied gender-affirming care for 5 years. According to a study published by the Journal of Adolescent Health, they found that for youth under the age of 18, gender-affirming care was associated with lower odds of recent depression or recent suicide attempt. Gender-affirming hormone therapy can be used as a mechanism to reduce feelings of gender dysphoria and minority stress among transgender and non-binary youth, working to improve mental health outcomes and prevent suicide. Between January 1 and August 30th, 2021, the Trevor Project received more than 10,800 crisis contacts, calls, texts, and chats from LGBTQ youth in Texas looking for support. More than 3,900 of those crisis contacts came from transgender or non-binary youth. The Austin American...
Would the gentlewoman yield for us?
Representative Toth, for what purpose?
Would the gentlewoman yield for
Does the gentlewoman yield?
I will.
She yields.
Do you want to go a little longer? I don't want to interrupt you if you want to take more time.
If I will finish then, and then I will take your questions.
Thank you.
So the potential result of the bill could lead to an influx in trans youth experiencing mental health crises. This amendment simply studies the suicide rates and the numbers of suicides that occur as a result of this legislation. And I hope that the study would not only look at suicides, but also those who attempt or cry out for help. And I just want to say very quickly before I answer your questions, Representative Toth, that I have a friend, our kids grew up together. They went to elementary school together, my daughter and her daughter, and they were close. She spent the night at our home, but in high school, this friend's daughter transitioned to male, and she told me about it, and initially I was shocked because it's not something that you expect. And I said, well, how do you feel about that? And she said, well, my husband and I both support this transition because it's what's right for our child. And his brother supports it too. And I watched for years their support of their son, that he now is happy in college. You know, parents don't ask their kids to change genders. It's confusing. And the thing is, I also know what it's like to have a child who is dealing with some really difficult issues and depression. And when they cry out to you, when they say, Mom, I don't see the point in living anymore, you are going to do anything it takes to help your child. And I am so concerned that this law is going to drive some kids to somewhere unthinkable. Now, my friend's child has decided to move out of state or is strongly considering moving out of state. And that's obviously the better option. But some of these kids, they're going to give up because the state has told them they shouldn't exist. And with that, I yield.
Representative Toth, for what purpose?
Will the gentlelady yield for some questions?
Gentlelady yield for questions. She yields.
Representative, what is the current suicide rate among these kids?
I don't know, and that's why I think that we should study it so that we can determine what it is going forward.
What data point would you take if your amendment were to become law? What data point would we take when we don't know what the representative sample is of kids currently?
Well, we can look at the number of calls into hotlines such as the one I mentioned at the Trevor Project. Now, that's not suicides, but I'm sure that...
But your amendment is to track suicides. And
exactly.
If this were to go into... If this law passes, it becomes law.
So
you want to set up a study, but you don't have anything to compare it with.
So it's a 5-year study. I don't recall when this goes into effect.
Why have you not sought to do this prior to this law?
Why have I not chosen to do this prior to this law?
Correct. You've given a lot of anecdotal information today. We've heard a lot of anecdotal information, but why not? Why has there been no desire to study this before this?
It's possible that there's some of that data out there, and I would hope that with this being...
Yeah, there is. So the Tavistock study in London says it's 0.03%.
Maybe we can look at data in Texas. And I would hope that if, like I was saying, if this is included in the new bill, the law, then they can do some digging and try to extrapolate what the current suicide rate is, and then we can look at it going forward as well.
Thank you.
Thank you, and with that, I move adoption.
Chair recognizes Dr. Alverson to speak against the amendment.
Thank you, Mr. Speaker, members, and I appreciate my colleague bringing this amendment. And obviously, I think that suicidal ideation, and suicidal attempts are something that we should take very seriously. And unfortunately, that has gotten conflated with the issue of gender dysphoria in an extremely negative way. We have talked to not only medical professionals, but people in the community who have expressed to us that this is a difficult issue on many levels. And it turns out that the literature actually doesn't support the idea that gender dysphoria or treatment of gender dysphoria has any effect on the rate of suicide attempts or completions. And yet there is this narrative out there, unfortunately, that the two are intimately linked. And so
Mr.
I think we
Speaker?
have to be really, I'll answer your question in a second if that's okay.
Representative Sweener, for what purpose?
Will the gentleman yield for some
Let me
questions?
Gentleman
finish,
yield for
and I
questions?
will,
Not
I
at this
promise.
time.
I think we have to be really careful about this conversation. I respect the amendment that she's bringing. I believe that we already look at these things, and I know that science continues to study this and look at this precisely because of the false association between the two. But I would just caution everybody in the gallery and everybody in the room that when you're talking about a person taking their own life, you're talking about somebody that has known mental health problems, that linking legislative acts or linking behavior or linking feelings about yourself with the idea that somehow that should be connected with suicide or a suicide attempt, I think is something that we should refrain from. And I think that's something that we should take very seriously. And I believe very strongly that if you are thinking about hurting yourself, you need to get help. And I want you to get that help. And that help is mental health therapy, and mental health. And we do not want people attempting suicide. I have, as a doctor, unfortunately cared for many patients that have come to the hospital that have tried to kill themselves, some in an attempt to, because of another psychiatric condition that was poorly treated, and some because they really felt that they were at the end of their rope. But I would just say that this is not something we should take lightly. I do think that this amendment is unnecessary because I believe this is something that a wide variety of agencies and sources are studying and looking at. But I would just ask all of us to be very careful in choosing our words when we try to link these two things together, because the science doesn't support it, number one. And number two, if we're dealing with somebody that's already struggling with mental health conditions, and you make the connection between suicidal ideation and whatever they're struggling with, that is not a good combination. So I'm happy to take your questions. Yes, ma'am.
Mr. Speaker?
Ms. Weiner, for what purpose?
Will the gentleman yield for questions?
The gentleman yield for questions.
Representative Oliverson, thank you for talking about how important mental health is. I think you and I are in alignment on that. I know that representatives like myself and Representative Goodwin and other members of the LGBTQ caucus, our number one goal is for trans kids to get a chance to grow up. And I know we don't take this lightly at all. So my question for you is this: do you believe our concerns about suicidality in transgender youth and being related to affirming care are in earnest?
Representative,
I know you disagree, but do you believe we're in earnest?
I think that suicide, I do believe you're in earnest, but I want to be clear that I believe that the two issues, that the medicalization of kids struggling with gender dysphoria and the link to suicidal thoughts versus attempts or completions, is something that the literature got wrong from a very early stage. And unfortunately, it, I believe, has stigmatized this whole conversation when we should have been focused on mental health. Instead, we went in a total opposite direction. And unfortunately, a lot of times it was the provider's fault. They were the ones that were telling parents, if you don't transition your kid right now, they're going to kill themselves. That is not supported by fact. There's not a study out there that supports that notion, and it is completely medically irresponsible for somebody to present that false narrative to a parent. And yet we talked to parents, and we heard time and time again that this in fact was what they were told. So this is why this issue is a very sensitive issue. I know it's sensitive to you, but I think we have to be really careful how we enter this conversation.
So if you believe we are in earnest, and we have material disagreements about what we think the literature supports, what is the harm in the study that Representative Goodwin has proposed? Presumably, Representative Oliverson, if you are correct, her study would help demonstrate that. Or if it turns out that you're incorrect, it would help us potentially adjust. So what is the harm in being safe, being careful, putting every bit of value on these kids and their futures that we can, and doing that study? What is the harm?
So two things, Representative. I don't know that it's necessarily about a harm. I think it's, number one, I think it's duplicative. I think this data is already being collected in various sources. And number two, I know that this issue is in an area of intense study. This is one of the outcomes that people look at when they look at various treatments for pediatric gender dysphoria, is if a child is experiencing thoughts of harming themselves, what effect does this treatment have on that? And that's why, to me, this is something that I mean, in some respects, I'm glad we brought this up. In some respects, I've heard from folks that in the community that are like, this is a really tough issue for the community. And so I just want to be respectful and careful about this, and I do not want to say anything or hear anything said here during this debate that would lead a young person struggling with identity issues of who they are and who they might want to grow up to be, to think that the only way that they can get help is to attempt to take their own life, because I think you and I would agree that that is a horrible narrative to put out there.
Well, thank you for answering my questions. I think we see this very differently, and I'm disappointed that you're not willing to further study this. But
Thank you, Representative.
The chair recognizes Ms. Goodwin to close on the amendment.
Thank you, Mr. Speaker. Members, it was brought to my attention that the American Academy of Pediatrics has looked at this data, and that actually there is a higher rate of suicide among transgender youth. 50% among boys, 30% higher among girls. So I do think this is an incredibly important data to collect. I don't think the youth under 18 are going to be reading our laws and seeing that we're collecting this data. I don't think that it has to be widespread that, hey, we think that there could be a link between your gender dysphoria and suicidal ideation. But I do think it's incredibly, incredibly important data to collect to know whether this law is causing harm or not. And if it dispels that myth, then great. But we can't know whether it's true or not that transgender kids are more likely to commit suicide if they don't get the care that they need if we don't collect data. And that's all this asks for. So with that, I move adoption.
The question occurs on adoption of the Goodwin amendment. The amendment is not acceptable to the author. A record vote has been requested. The clerk ring the bell. So Ms. Goodwin voting aye, Dr. Oliverson voting nay. Have all members voted? There being 57 ayes and 82 nays, the amendment fails to adopt. The chair recognizes Dr. Oliverson to close on the bill. The chair recognizes Mr. Bryant to speak in opposition to the bill.
Gentlemen, I will be brief, but I believe that what we're about to do here is so damaging to the people of our state and to this very small percentage of our society that it's not responsible to sit in one seat and not speak up about it. If you have ever met a family that has a child that is transgender and listen to them with an open mind, tears will come to your eyes. The hardest-hearted person in this room will be moved emotionally to hear their story. And to hear the story, in the case of a family with a child born as a boy, and yet knows somewhere in their heart that they're a girl. And to hear the father say, I wanted my son to be a boy. I wanted him to man up. I wanted him to be macho. I wanted him to be like I am. But from the earliest time, he said, I'm a girl. I don't want boy toys. I want girl toys. I don't want boy clothes.
I want girl clothes. Now, this is a mystery. And all you folks that see a great deal of your lives through religion, you know as well as I do, life is a mystery. We can't figure these things out. And people devote their entire lives to studying these kinds of mysteries and trying to figure them out to the extent that somehow they can provide relief to those who are suffering in the midst of these mysteries. Now, we have to keep that in mind as we analyze this. Representative Oliverson is not an expert and doesn't claim to be an expert. He's an anesthesiologist. I have great respect for him, not only his career, but his legislative accomplishments. But he is not an expert in this area. One would have to give their entire career to this area to know about it and to become an expert in this area. And for this family, who we all personally know, real families like this, they deserve to be placed in the hands of experts and not have their lives governed by the political winds that blow us back and forth. You know, that is exactly where we find ourselves tonight. We have access to those experts, and we have access to those experts right now in real time. Not Dr. Oliverson and those that support his point of view who are not experts, but the people that really know the territory. The American Medical Association, the American Osteopathic Association, the American Psychiatric Association, the American Psychological Association, the American Public Health Association, the American Academy of Child and Adolescent Psychiatry, the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, the Pediatric Endocrine Society. All of these say that medically necessary treatments should be made available according to the understanding of the experts for these children. That's who we should be listening to, not to the people who this year are concerned about this issue and next year will be concerned about another issue. What is the first rule of medicine? Do no harm. And yet we're watching harm being done all over the United States as we deal with this temporary political issue. I just ask you to stop and think about what it means. We heard a lot of words about medical irresponsibility a moment ago. To be medically irresponsible is to ignore the experts and to go with the lay people who just have opinions and those who admit that they're not experts, as many of those who are debating this issue tonight. Let's do what is politically responsible. Politically responsible means to be leaders. It means to go home and say, look, this is complicated. I'm not sure what this is all about, but I know this. I don't know as much as all the people on this list right here, whose names I just read to you. They're the ones that know what to do. They're the ones that ought to be making the decisions in this area, not a bunch of folks who are in politics like you and me. I urge you to look into your hearts and to vote against this bill and do the right thing for these little kids and for their mothers and fathers and not deliver any more anguish into their lives. Please vote no.
The chair recognizes Mr. Tinderholt in favor of the bill.
Thank you, Mr. Speaker, members. I want to speak on behalf of this bill. I asked for this committee for this bill. I used my seniority pick. I strongly believe that these children need and deserve the mental health attention that they should get to help them through this issue. During the committee hearing, we heard many children who grew up and they wanted to detransition, or they were in the middle of detransition or had finished detransitioning. And they agree that this is child abuse. I think it's important for us in the House to send a message to 30+ million Texans that we care about Texas children. And we believe that these children deserve to get the care that they need, mental health assistance, but that we will protect them from being abused as children and have puberty blockers given to them and have them permanently sterilized so that if they decide later, which many of them do, to detransition, that they can no longer have children. So I stand in front of you tonight in full support. Let's send a message to the millions of Texans that in this building, we will protect Texas children. Thank you.
The chair recognizes Ms. Thury to speak on the bill.
Members, it is out of respect, caring, and friendship for every member of this body that I would like to share my position on this very complex issue. I'm coming from a place of love and compassion and can only hope and pray that it is received in that same spirit. While we can have debates on the best policy approach, I do not believe that any of us in this body actually wants to cause harm to children who are suffering from depression, dysphoria, or any other mental health issues. Over the past 2 years, I have extensively researched this issue and painstakingly reviewed the scientific data in this country and around the globe. I have listened to my constituents, to advocacy groups, and stakeholders both for and against gender modification. As a woman of color, I know what it's like to feel unseen, unheard, and devalued. I have recently been treated that way by some in this process in coming to this vote. That is not what children experiencing gender dysphoria should have to go through. And I believe this debate should never and was never about erasing transgender children. For me, this discussion is about how best to protect and care for these children as they navigate through the challenging journey of finding the best version of themselves. After listening to the debate today, I absolutely believe we should raise the age to 18 for children to receive GnRH analogs, cross-sex hormones, and to undergo potential irreversible body-altering surgeries. I am assured that this position is rooted in sound policy, which supports the mental health, physical development, and overall well-being of minors. Members in this nation, most all adults, have been united in at least one basic premise: that children deserve protections, special protections, and exceptional treatment under the law. As a legislative body in this state, both Democrats and Republicans alike have routinely enacted legislation which shields children from acts which place them at an increased risk of harm. This principle is established in many areas of public health policy, such as restricting the age to 18 for tattoo services in this state, restricting the age to 18 to get a tan at a tanning salon, raising the age to 21 to purchase tobacco, cigarettes, and e-cigarettes. These policies and regulations are in place because we recognize that children should be protected from actions and activities which have harmful health risk or lifelong consequences. This same logic must also apply when approaching the very complex issue of treating gender and body dysphoria in children. As we heard here today, right now in the United States, there is not one universal policy or standard of care on the appropriate age that cross-sex hormones should be administered in children experiencing gender dysphoria. In fact, there is significant divergence amongst both the medical and scientific community. One of the key aspects of this debate is the use of drugs, which delay a female child from menstruating, or a biological male child from physically maturing into his adolescence. Puberty is a natural biological process, as it serves a critical role in both the physical and mental development in all human beings. Concerns have been raised that hormonal suppression of puberty may permanently alter a child's neurodevelopment. It is only honest to admit and accept that we do not know of the long-term effects that prescribing GnRH analogs, cross-sex hormones, as young as 8, 9, and 10 years old, of what that will do to children, solely for the purpose of affirming gender dysphoria. What we do know is that these drugs can cause harm to a child's health, including the early onset of osteoporosis, incontinence, increased risk of blood clotting, stroke, and heart attack, infertility, and sterility. Moreover, as we all agree, the decision to undergo body-altering surgery to remove healthy breast tissue in biological females or to remove male genitalia in biological males cannot be reversed. While these surgeries should happen after the age of 18, there is no such law codifying that in Texas without the passage of SB 14. Science has already proven that the frontal lobe section of children's brains are not fully developed under the age of 18. As Democrats, we've espoused this principle many times on the raise the age to 18 for criminal culpability. The data on teenage brain development has shown that because the prefrontal cortex, the frontal lobe, is responsible for decision-making, planning, and thinking about the consequences of actions, teenagers rely more on another part of the brain, the portion of the brain that unduly influences their emotions, impulses, aggression, and instinctive behavior. Certainly, children as young as 8, 9, or 10 are completely incapable of understanding that these medical treatments may require that they remain patients for the rest of their lives. For example, what are the long-term effects of administering the chemotherapy prostate cancer drug and chemical castration drug known as Lupron to a child who is otherwise physically healthy but is experiencing gender dysphoria? Just last year, the U.S. Food and Drug Administration added a warning to the drugs known as puberty blockers. It indicated that there is a plausible association between puberty blockers and pseudotumor cerebri. This condition occurs when the pressure inside the skull spontaneously increases. This can cause brain swelling, severe headaches, nausea, double vision, and even permanent vision loss, according to the Mayo Clinic. Earlier this year, the American College of Cardiology released a study finding that people with gender dysphoria and taking hormone replacements as part of their affirmation therapy face a substantially increased risk of serious cardiac events, including stroke, heart attack, and pulmonary embolism. There's also literature that suggests that long-term use of estrogen and testosterone in children may cause polycystic ovarian syndrome. Despite talking points to the contrary, the data is inconsistent that the rates of suicide and depression will be improved by administering these hormones. Lastly, several European countries, which were on the forefront of administering this treatment, have reversed course. They are taking a more cautious approach now to the use of puberty blockers and cross-sex hormones in minors. Finland now recommends psychotherapy as the first-line treatment for gender dysphoric youth. The Swedish Health Authority no longer offers puberty blockers to minors except in exceptional cases, stating, the risk of puberty suppressing treatment with GnRH analogs and gender affirming hormonal treatment currently outweighs the possible benefits. Certainly, the topic of gender and body dysphoria in children requires careful consideration, caution, and compassion. Sadly, the discussion has become polarized and politicized. In fact, while many of my constituents encouraged me to vote in favor of this legislation, hostile activists on social media platforms have made horrific, nasty political threats to influence my vote against the bill. These personal and often racist attacks on me as an African American woman are neither productive nor persuasive. Privately, some have shared in confidence that they agree with the bill, but they are too afraid of the retribution. For God has not given us the spirit of fear, but of power and of love and of a sound mind. So it remains my legislative duty and my moral obligation to vote the conscience and core values of my constituency. I will do this today with an open heart and a clear mind. As a thoughtful legislator, mother, woman of faith, and child advocate, I am making a decision to place the safety and well-being of all young people over the comfort of political expediency. It is my core belief and conclusion that we should remain consistent in the premise that children must be given special provisions under the law, as they cannot fully appreciate the long-term consequences of their actions. As such, the best practice should be to raise the age to 18 for gender modification. Moving forward with this prudent policy, we should also ensure that vulnerable children and teenagers have quality access to mental health care that is safe and in a supportive environment. Only by taking a careful, compassionate, and evidence-based approach to this issue can we guarantee that we are doing what is truly in the best interest of our children. Thank you.
The chair recognizes Mr. Rosenthal in opposition to the bill. Mr. Tepper, for what purpose?
I'd like to request that Ms. Theory's comments be reduced to writing for the journal.
Members, all the debate and comments on today's legislation has already been reduced to writing and placed in the journal. Mr. Rosenthal.
Thank you, Mr. Speaker. Members, I'm going to start out by saying I'm a straight white guy. This is not my experience. But I do have friends, family, constituents that I love and care about, and I've been at this microphone to talk about this issue before. Members, trans rights are human rights. They're human rights. With this bill, this is government, this is big government, trampling on the fundamental rights of our constituents with government overreach into their personal lives, interfering with families' most private and personal decisions. Y'all, these are just humans trying to live their lives. They are only seeking their most basic, fundamental right to pursue happiness however they see fit. Y'all have seen the commentary on gender-affirming care we all have in this chamber today. We've been inundated with hyperbolic and alarming messaging using the most egregious and ugly language. We have seen truckloads of false and misleading statements, stoking fear and hate. These damaging narratives would have us believe the very worst of each other. Look at your neighbors and the chairs next to you, and it doesn't matter what letter is after our name. There is not a single member of this body that I believe wants to harm children. And the language used around that is beyond egregious. It's horrific. And these lies and misinformation narratives are being repeated over and over and over again in social media circles, shared by email, text messages. We have seen testimony here in this room, in the Capitol. It's been repeated by elected officials on this microphone here today. I have heard over and over, it said today that studies show 80% of children just given psychological care revert back. That was broadly debunked. I have studies and studies of studies. I would invite the author to actually cite the reference for that, because I have studies that show National Institute of Health, factors leading to detransition among transgender and gender diverse people in the United States. This is peer-reviewed research about research by actual scientists. So listening to scientists and medical researchers, people who make their whole life about this, instead of listening to politicians, loosely use facts, loosely use data, loosely use stuff that they heard. All of us have some friends that say, I do my own research, immediately followed by bald-faced mistruths. Members, what we're talking about here is care for kids. We all want our children to have the very best care possible. And although we may disagree on what that looks like and what it is, in a society like ours, most often we defer to families as being the ones to have the best interests of their individual children at heart. These are delicate, difficult, individual, nuanced decisions to be made by families with their faith, with their doctors, with their medical providers, psychologists, psychiatrists, the professionals that work with care and love to provide the best care possible for each individual child. We talk about one size doesn't fit all for 254 counties, one size doesn't fit all for 30 million constituents in our state. Okay, y'all have heard of the American Medical Association. We talked about it a little bit tonight. American Medical Association has over 271,000 members. This is not a small organization. They were founded in 1847. On their website, they claim they are the only medical association that convenes 190 plus state and specialty medical societies. And this is a quote from the American Medical Association. The AMA opposes the dangerous intrusion of government into the practice of medicine and the criminalization of healthcare decision-making. Gender-affirming care is medically necessary, evidence-based care by professionals that improves the physical and mental health of transgender and gender-diverse people. In 2021, the AMA delivered a letter to the National Governors Association urging state governors to oppose legislation just like this. The letter cited evidence demonstrating that foregoing gender-affirming care can have tragic consequences for transgender individuals who face increased risk of anxiety, stress, substance abuse, and suicide. The majority of transgender and diverse gender patients reported improved mental health and lower rates of suicide after receipt of gender-affirming care. The bill and the false negative and rhetoric around it politicizes kids who are often fragile and at a delicate juncture in their life. It's wrong and immoral to take these delicate decisions away from the families. Members, time and again, when legislators seek to contravene the experts, especially in complex fields of study, it never ends well, and neither will this. Members, our Constitution and our House rules require us to hold public meetings so that those who wish to be heard can come to their state capitol and testify before us, before decision makers. This is the people's house. It's our responsibility to listen to the people. We do a great disservice to the people when we alter our processes to silence the voices of the citizens of our state. And that is exactly what happened in the committee hearing for the companion bill to this in the House. In what might be an all-time record, over 3,000 Texans came here to the Capitol and registered a position on the bill. 2,917 registered against, 97 registered for. Around 400 people actually registered to testify. We were watching this whole thing from my office. I saw the entire committee hearing. Only a couple of dozen people actually registered to testify for this bill. Do you know how many total were allowed to speak? With over 450 people who registered to testify on this bill, either on, for, or against, roughly 50 people got to speak. And most of them were cherry-picked or preferred testimony, invited testimony. I'm just going to say it again. Trans rights are human rights. When this body seeks to infringe upon the rights and liberties of our citizens, we should at a minimum have the fortitude to face those people and hear them out. I hope you can agree with me when I say, when the government seeks to intrude into our private lives, the government is making an error. It's always wrong. Please vote no on this legislation.
The chair recognizes Mr. Emanuel to speak in opposition to the bill.
Thank you, Mr. Speaker and members. Many of you know that I have done everything possible to stay off of either one of these mics unless it's about legislation, unless I care about this. And I'm not gonna cry, and I'm not gonna make this about me being gay. That's pointless, because this issue is about transgender people and their families, these children and their families making medical decisions. One of my favorite authors, Virginia Woolf, she says, their thoughts are our prison, their eyes our cage. This legislation is creating a prison and encaging these people in them. They are not asking you to stand with them at a parade. They are not asking you to change your religion. They are not asking you to believe what they believe. They are asking you to let them have their parental rights. That's all they're asking. I'm an asthmatic child, and my parents had to give me medicine that used to make me shake so profusely it would keep me up at night. And as I got older, there was new medicine that didn't make me shake so much at night. Medicine is ever evolving just as people are ever evolving. I'm gonna read to you what a transgender child parent sent to me when I asked them about bone scars. And I'm gonna say this, we've heard facts, and this is the difference right now in this world that's wrong today. Everybody has someone they go to for their facts. But just as I cannot tell a woman what it is to be a woman, and you cannot tell me what it is to be black, you cannot tell a transgender child or their families what they have to take care of their children with. Bone scar scans are standard to ensure that this does not happen. This child, said parents, they have several monitors to make sure they are not losing bone density. If puberty blockers are being administered that young, it would be for precocious puberty. That wouldn't be used for gender care, and no one starts hormones that early. I asked if children are starting this at 8 or 10 years old. The highest risk is when you are on blockers for long periods of times without hormones, awaiting more answers from my physician to give you for best practice care protocol. Imagine Someone coming into your home telling you they can raise your child better than you. Imagine at one point, I'm going to invoke this person. He's probably going to go crazy today, but I'm going to do it. Former Representative Jonathan Stickland stood at this mic one day and said, members, there's going to be something that every one of you are going to love and be passionate about one day, and you don't want someone to take that from you. Well, for these people, that's their children. So I don't care if you listen to Fox News or MSNBC. I am asking you to listen to these families. I don't care about me. I don't care about any of you. I care about these children. I care about your children, and I care about your children not being told what they can take, what they can watch. Everybody in here knows I'm a daddy's boy. When I see a father and see him with his children, I will cry. My father stood up for me more times than I can ever think of. A man who raised me in the military, woke me up to make sure I did my homework at 2 o'clock in the morning, went through my room to make sure that I wasn't doing drugs. I had a father. These children have parents who are taking them to therapy. They are taking them to doctors. They are not getting all, oh my God, my child said I saw a television show and now they think they're a girl. That is not how this works. I have a step aunt. Even though they are divorced, she was transgender. She is transgender in her 60s. She transitioned in the late 80s. She's still alive. And I guarantee you, any of you, if you want to see a picture of her, because I've shown them, she's beautiful. And the reason that people feel sometimes that they have to digress and that they need to go backwards is because of societal pressures telling them that they are not okay. One thing that I have said and I know is that my God loves me, and I'm going to tell you why. My family makes fun of me because I pray over dessert. I thank God for water. I thank God that I can use the restroom because that is a blessing. That is a blessing from my Creator. I was raised in a Black Baptist church. But I do not go to anyone's church and ask them to change what they will believe. If you don't believe in same-sex marriage, I'm okay with that. If you don't agree with transgender, that's okay. I'm okay with that. But again, remember, do you want someone to come into your home, to your church, into your job, into your law practice and tell you, you can't do that because I don't agree with it? And I won't say this member, but there's one member in here who I have great respect for, and they say all the time, why are we letting outside influences influence this body? We will not send gambling to them. We will not send tax reform to the voters, but we will darn sure tell them what they can and cannot do. We were elected to go through the facts, to listen to each other, to be diplomatic. This is a body of diplomacy. This is not a third world country where we talk about each other on social media and call each other pedophiles and perverts and demons and allow it to continue. This is a body that is supposed to put everything aside when we walk through those doors and the R's and the D's fall. And many of you know I take a lot of stuff for voting for the things I believe in. And it's not always Democratic stuff, and you know it. I live in an area where so many people get cancer, but it's the best environment for them. And we try to make the best of it. And sometimes I can't vote as green as I would like to, but it's always my district first. I am asking you, I am imploring you to be magnanimous with your vote, to give these families their right to just raise their children so that when they grow up, they know that they had a parent who loved them. Because this is not an easy situation. Everyone in here would do something different. None of us in here would do the same thing. None of us in here like the same foods. And I'm going to end again with one of my favorite authors who I love. Virginia Woolf says, every human being has a say in the matter of their prescription. Even the lowest patient has some say. Therefore, by she defines her humanity. Let us define our humanity by being humble. Pride comes before the fall. I understand for some of you there is a scorecard. And I know it may not work for some people. And if God gives me the breath, if God gives me the width, I will cancel every vacation for anyone who needs my help. I don't care what you have an R or a D behind your name. I am asking you to vote for these people's parental rights. I am not asking you to vote for me. I'm not asking you to vote for anything. I am asking you to just remember that these children love their parents and their parents love them as much as I know you love your children and your families. Thank you for your time.
The chair recognizes Ms. Jones of Harris in opposition to the bill.
Mr. Speaker, members, I will rubber stamp what Representative Rosenthal said, which is trans rights are human rights. It is hard, it is scary to figure out who you are as a person who's, I don't know, fits into what is normal for society, whatever that means. But I am telling you as a member of the GLBT community, and I know for a fact that trans people are treated way worse than gay people. And I know I was so afraid of coming out, even though everyone sees this strong person. I was in the closet for years because I was afraid of judgment. But nobody tried to regulate what medicine I can take or what medicine I can give to my child because I'm a parent. And I know that people don't choose to be ostracized. People don't choose to be different when you know everybody looks down on you. So when a child figures out who they are, we should support them. No one chooses. As a former athlete, I've had a ton of surgeries. Surgeries are not fun, but sometimes they are necessary. No one chooses to take hormones and be different or get surgeries because it's a fad. It's not so easy to know what's male and female, despite what people said. And I didn't understand that until I had a friend who was intersex. And what she explained to me is that her grandmother was intersex. She was born intersex. She had both sexual organs, or at least the doctors thought so. So they let her parents choose. They chose wrong. Caused her a lot of problems. She was just like my client that I spoke about earlier, who got in the girl line, who got in the girl line, even though people thought that she was a boy. When you are a parent, there's no book on how to parent. You could have 3 different kids and 3 different things work with them. So you've got to figure out the parenting style that works best for that child. And as parents, we want to be really good parents. We want to support our children. If our children come to us and they want to be something, or there's something that we don't want for them to be, like maybe I'm a lawyer and I want my child to be a lawyer. No, we should let our children be whatever it is they are, and we should support them. I believe it's absolutely offensive of government to tell a parent how to parent their children. And yes, we're talking about parental rights, but we're also talking about children's rights as well. Who are we to tell these children that they don't know who they are? It's just not right. I sit on the Public Health Committee. I was there for that March 27th hearing. We knew in advance that the odds were stacked against us. We knew the committee was going to end at 12 midnight. We also knew that there was an overwhelming number of people who came to speak against the bill. But it was just really curious how, if you just looked at who testified, that you actually thought that there were just as many for as against people. We created a fiction, although government is supposed to represent everyone. I also find it curious that we're disregarding U.S. science. When in Texas, we think Texas is its own country, and we don't listen to anybody else. And we surely don't listen to people across the pond or overseas, but now we're clinging to science in other countries very far away. I'm Black, if you can't tell, for 57 years. And in my community, we tend to be not real understanding of LGBT people. But I learned about the unique challenges of transgender people when I was a city council member in Houston, and I had an openly trans woman working in my office. And I know when I met Josephine, she didn't have money to be able to afford surgery. She was suicidal because everyone was telling her she was a man when she was a woman. And they tried to force her to go to a certain restroom, and it was just horrible. They just found reasons to pick on her. And what I hadn't figured out is why in the LGBT community, generally, in the trans community specifically, why we worry about what they're doing when they're in their homes by themselves with whoever it is they want to be. We don't micromanage heterosexuals. Why are we micromanaging or trying to micromanage people in the LGBT community, especially trans people? We should be kind, we should be tolerant. God doesn't make everybody the same. It's also interesting to me, I practice law. There's 3 standards. There's a preponderance, there's clear and convincing, and there's beyond a reasonable doubt. So in order to lock somebody up, it's got to be beyond a reasonable doubt. In order to take a child away from their parent, it's clear and convincing. It's more than just a preponderance. Because this state and this nation recognize how important it is for parents to have a right to be parents to their children. So I'm just trying to figure out why we are just so adamant about interfering with a parent-child relationship. I don't understand that. If any of you in here are parents, and I know a lot of you are, I want for you to try to walk in the shoes of a parent who has a transgender child. Your child comes home and tells you something because everybody wants a straight kid and they want him to be tall and handsome and have a good job, and they're not what you want for them to be. Are you gonna terrorize your child to make them be who you want them to be? Or are you gonna try to figure out how to be the best support for your child? And are you gonna advocate for your child? So yeah, it's about parental rights, but it's also about children's rights. And I'll end on this. I think you judge a society not how we treat the best of us. We judge a society by how we treat the least, the last, and the lost of us. And transgender people in this country and across the world are treated horribly. They're murdered at a higher rate because we don't believe in their humanity. They are people just like we are people. They bleed just like we bleed. And they deserve our love and our support and our tolerance. And so I'm speaking against this bill because it's the right thing to do. And I'm going to have the courage to vote for children to determine who they are, and for parents to be as supportive of their children as they can. And just because they are trans does not mean that they are not entitled to all the rights and appurtenances that U.S. citizens deserve. And I'm urging you to please vote against this bill. Thank you.
The chair recognizes Dr. Oliverson to close on the bill.
Thank you, Mr. Speaker, members, and I close.
The question occurs passes third reading, SB 14. This is a record vote. The clerk ring the bell. Dr. Oliverson voting aye. Have all members voted? All members voted. There being 92 ayes and 48 nays, SB 14 is passed the third reading. Members, regarding next week's work schedule, the House will convene at 1 p.m. Monday, 10 a.m. Tuesday, 10 a.m. Wednesday, 10 a.m. Thursday, and 9 a.m. Friday. Members, the Speaker's desk is clear. If you have any announcements, please bring them down front. Ms. Pleasa moves the House adjourn until 1 p.m. Monday in memory of Cindy, Ryan, and James Chow of Allen. Is objection? Chair hears none. The House stands adjourned.